Hello and very good evening, friends. Namaskar. Yeah, hello, Dr. Rebel, Abhinandan, Mahesh, Medico Vishal, Neha Singh. Hello, everyone. Hello and very good evening. So, chaliye. I think everybody knows that, of course, it's been old news now कि exam delay है, NEET entrance exam. So, there might be some students who are preparing for the NEET entrance exam and the exam is delayed. First of all, I would just like to say that, beta, please note, I hope everybody is able to hear me and see me. Dustin George, hi and very good evening. NLC Calicut. Yeah, good evening, everyone. Good evening. I hope you can just everyone hear me and you can see me. You can see me. Just give me a thumbs up. Good. All perfect. 1440 पे चल रहे. Okay. So before I start, beta, there might be some students who are appearing for the NEET entrance exam. That's it's been happening since very long years. When I was appearing for the NEET entrance exam, उस time पे NEET तो नहीं था, All India exam होता था. So there used to be Maharashtra entrance exam. I went to Mumbai to give this Maharashtra entrance exam, and just before 2 months of the exam, उन्होंने delay करा and they postponed. So it keeps on happening all the time. And specifically talking about the UPSC exam, the civil services exams, CMS exams, कितने law के exams होते हैं, they keep on happening, postponing. It's a very regular feature in Government of India exams. So अगर अपना भी एग्जाम हो गया तो ठीक है. आई एम नॉट सेइंग दैट इट्स आउट ऑफ द वर्ल्ड, ये फर्स्ट टाइम हुआ है, इट हैपन्स. So in case you are appearing for NEET entrance exam, beta, I just want you to understand that exam is about testing yourself. So keep on doing your studies. इसको छोड़ना नहीं है. Trust yourself. If you want to do some job, कुछ और काम देखना चाहते हो, कुछ और काम है, घर का काम है, you can very well do that now. But don't leave the studies. Keep on the momentum. How will you keep on the momentum? Momentum ऐसे रखना है that I know you have already must have started your revisions, है ना? So momentum ऐसे रखना है that you are not going to take any break and you are going to continue giving the subject wise test. Bas, that's all that I need. Okay, you all have to give the subject wise test. Subject wise test for all the NEET exam aspirants. NEET exam aspirants, आपको अपना subject wise test देते रहना. You fix your monthly and then you fix your weekly targets. You fix your weekly targets, you fix your monthly targets, and you keep on giving the subject wise test. सर FMG देखना चाहिए ये ना, आई डिड द सेम मेडिकल एग्जाम में बार बार क्या होता है. सर इज दिस सेशन फॉर FMG? यस शुभम, दिस सेशन इज पर्टिकुलरली फॉर FMG. आई स्टार्टेड माई स्लाइड विद दिस दैट वी आर गोइंग टू डिस्कस 6 years of last FMG right from year 2018 से लेके मैं 2023 तक 2023 तक आई एम गोइंग टू डिस्कस ऑल द MCQs which have been asked in the 6 years. So this is a mega session where I'm going to cover 6 years of FMG entrance exam. So इस बार इस ऐसा पढ़ा कि सब कुछ आना चाहिए एग्जाम में. फ्यूचर डॉक्टर, वेरी नाइस. या पुरानी आदत है NBE की. So beta, all the NEET aspirants, you need to keep on your momentum. All the FMG students, there you go. I am coming to you with the 6 years of FMG topics, and this is I'm trying to start the Wednesdays with Mukhmohit again. And in this, every Wednesday, I'll try to come online for 30 minutes or 1 hour, and we'll try to discuss all the controversies that you have, all the updates that you need, so that you all are like up to date. हिंदी में पढ़ाओ. नहीं भाई, मेरे हिंदी में नहीं हो सकता पूरा हिंदी में, बिकॉज देर आर स्टूडेंट्स फ्रॉम केरला, देर आर स्टूडेंट्स फ्रॉम तमिलनाडु, एंड वी हैव टू लुक फॉर एवरीवन. आई विल ट्राई टू accommodate as much Hindi as possible, not everything. सब कुछ नहीं कर पाएंगे हम हिंदी में. Okay, so that's how it will be. Yeah, सारे क्वेश्चन सही करके आएंगे आफ्टर दिस सेशन. सो बेटा, इन केस यू आर लुकिंग फॉरवर्ड फॉर MCQ डिस्कशंस, अगर आप देख रहे हो कि क्वेश्चन एंड आंसर्स देखने हैं, टेस्ट देखने हैं, यू वांट टू सॉल्व MCQs, दिस इज द वीडियो दैट यू नीड टू लुक फॉर. You need to search for this video. Must know topics in community medicine, part 1, Focus FMG 2023. This was streamed 2 months ago on the Marrow FMG channel. So is channel pe you need to look for this video. It is available online and on YouTube free of cost. This is roughly around 2 hours 35 minutes part 1, and then you have the part 2, which is again 2 hours 35 minutes 3 hours. So it's a 5.5 hour session jisme everything about community medicine, the whole syllabus is done for you. So in case you have not yet revised PSM, you want to revise PSM in just 5 hours, this is the video that you need to watch. I am not going to discuss the total syllabus. My focus of today is 6 years of FMG topics. Okay, so yeah, चलो फिर शुरू करें प्रभु का नाम लेके. जय श्री राम जी. And this is the 6 years exam topics. Beta, 2018 we had 22 MCQs, 2019 24 MCQs, 2020 16 24. Average यदि आप देखो तो 20 questions average हैं 6 साल के. Today I'm going to discuss 126 topics with you. So let us take on the first year topic. 2018 ka questions were asked on these 22 topics from 2018. 2018 22 MCQs, 22 questions were topics were there. So first question is regarding the Chadda committee. Beta, what is Chadda committee? A very quick review about the committees. So सबसे पहले जो हमारी committee आई थी, that was the Bhor committee. Remember, Bhor is the boring committee. In the boring committee, they had set up the healthcare system in India. Mudaliar, you can remember that Mudaliar, L-I-A-R, Mudaliar, he was a liar. He told that we will start Indian medical services, but nothing happened. You can remember Mudaliar as Indian medical services. This is on the pattern of the Indian administrative services. Medical ke liye they wanted a separate league, which we don't have till now. So Indian medical system, that is Mudaliar. Chadda committee, they worked on the integration. Remember this word, they worked on the integration of the malaria program with all other program, and they started with the basic health worker. Whatever I'm underlining is what you need to remember. Next is the Mukherjee committee. In Mukherjee committee, just remember they disintegrated the family planning program from the malaria program. Next is the Jangalwala committee. Remember Jangalwala, Jangli rule, non-practice allowance, equitable salary. Kartar Singh, they started with the multi-purpose worker scheme. This has been asked 3-4 times in your exam. Multi-purpose worker scheme is Kartar Singh committee. Srivastav committee, again very important, frequently asked point. Srivastav committee is known for reorientation of medical education referral system, strengthening of the public healthcare system, referral system. Remember, strengthening of the public healthcare system by the referral systems. That was done by Srivastav. Bajaj is for financial norms and for manpower norms, and then we had the national health policy. Okay, yeah, PDF मिल जाएगा आपको डॉक्टर अभी @FMGE. ये जो हमने टेलीग्राम पे, ये आपको दिख रहा है यहाँ पे टेलीग्राम पे. On this Telegram group, right on top of me, you can see the link for the Telegram. On this Telegram group, you will get the PDF. So Chadda committee is known for what? Chadda committee is known for basic health worker, and Chadda committee is known for integration of malaria program. Malaria program को उन्होंने integrate किया था. Next MCQ, next topic was National TB Elimination Program, investigation of choice. So ये पुराना question है. I'm not going into the details of what were the guidelines in 2018. Let us discuss about the National TB Program investigation of choice for today. If you get a question on National TB Program investigation of choice for tuberculosis. Beta, if you get this question, investigation of choice for tuberculosis, it is CB NAT plus sputum microscopy. Sputum microscopy. If you get single best answer, I cannot say that इनमें से ना बेटा CB NAT is better or sputum is better, दोनों करने होते हैं. Both have to be done. They both have to be done. You cannot say that any one is the single best answer. But अगर आपको कभी फंसे हुए हो and exam में पूछ लिया, because what is happening is that in real you will never get this question that out of these which one is the better. बेटा what is happening is different platform पे different faculties or even बच्चे लोग MBBS लोग they are making these MCQs. So once they make the MCQs, they just get fascinated by the bookish language. So if you get stuck somewhere, mind the word, असल में ये नहीं आएगा एग्जाम में, आई कैन गारंटी यू दिस. बट अगर आप फंस जाते हो कभी तो सिंगल बेस्ट आंसर आपको CB NAT लिखना है. सिंगल बेस्ट आंसर बेटा आपको CB NAT लिखना है. सिंगल बेस्ट आंसर इज CB NAT दीज डेज. इन्वेस्टिगेशन ऑफ चॉइस फॉर TB. अगर पूछ लें नेक्स्ट MCQ, अगर पूछ लें पीडियाट्रिक TB, pediatric tuberculosis में sputum नहीं होता. Sputum you cannot do. Sputum microscopy is not possible. Why? Most of the time it is not possible. Why? Because the children cannot expectorate sputum. And because children cannot give sputum, therefore pediatric tuberculosis में the answer has to be CB NAT. Next is in case they talk about HIV patients or compromised patients. In immunocompromised cases beta, again sputum microscopy is not at all diagnostic or screening tool also, and therefore the best answer is again CB NAT. And that is for this reason only मैंने आपको बोला कि कभी आप फंस जाओ तो मार्क करना CB NAT, याद रखना. अदरवाइज बेटा जनरली स्पीकिंग व्हाट इज द इन्वेस्टिगेशन ऑफ चॉइस, दोनों रहेगा CB NAT एंड sputum. So that was for investigation of choice. एक और चीज़ पूछते हैं that what about the latent TB? Latent TB को कैसे diagnose? How do we diagnose latent tuberculosis? Latent tuberculosis is diagnosed using the Montu test. Montu test. Okay. Montu test कैसे करते हैं? How do we do it? We use one PPD. We use 0.1 ml of the purified protein derivative RT23. RT23 0.1 ml purified protein derivative, and this Montu test is usually read after 72 hours. Range होती है 48 to 96 hours, but it is usually read after 42 hours. After 42 hours, if it is more than 10, it is usually taken as positive. More than 15 अगर आ जाए, in normal cases it is always positive. It is always positive. More than 10, it is usually positive in many situations. For example, कोई immigrant आया है, somebody is coming from Bangladesh, somebody is coming from Bhutan or Nepal. In these cases, we take 10 as our criteria for immigrants or people who have any other comorbidities. So more than 10 ko we take it as that problem area, and that is for latent tuberculosis. That is the Montu test. Okay. And yes, important. Thank you so much, Extrano. Thank you so much for reminding me regarding TrueNat. अगर TrueNat ऑप्शन में आ जाए बेटा, TrueNat ये इंडियन वर्जन है. It is Indian version. It is less cost than CB NAT. It is lower cost than CB NAT, TrueNat. But if you compare CB NAT and TrueNat, TrueNat is slightly better. TrueNat is slightly better compared to CB NAT. Why? Because of low cost. Because of low cost. And because of low cost, TrueNat को हम ज़्यादा यूज़ करते हैं. बट अगर गाइडलाइन पूछी जाए, मैं फिर से बोलूँगा, the best single best answer over here is CB NAT. It is not TrueNat. अगर ये तीनों ऑप्शन में आ जाए बेटा, TrueNat भी लिखा हो, you have TrueNat, you have CB NAT, you have sputum, best answer is still CB NAT. Don't get fascinated by TrueNat. TrueNat, it is not available in the whole country for now. It's only available in very few districts in the country. Okay. Next is, okay, let's go ahead. कब करते हैं एक्सट्रानो, कब करते हैं TrueNat? इट इज़ अवेलेबल इन सम डिस्ट्रिक्ट्स. इन दोज केसेस वी डू TrueNat. नेक्स्ट इज अबाउट फैक्ट्रीज एक्ट. बेटा फैक्ट्रीज एक्ट में उन्होंने स्पेस का क्राइटेरिया पूछा था. Next is about Factories Act. I'll just take this off because it keeps on disturbing and tuck, 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 it keeps on happening. Next is regarding the Factories Act. Factories Act, which was established in 1948. Beta, please note under Factories Act, the space criteria is important. Space criteria is more than 500 cubic feet of space per worker. इतना जगह चाहिए, more than 500 cubic feet of space per worker. Under Factories Act, ये भी पता होना चाहिए आपको that how many hours people should work. So if generally speaking, it is not more than 48 hours per week they can work, the factory people, not me and you doctors. More than 48 hours is only for the factory people. So factory labor class, 48 hours per week, and with overtime they can work for not more than 60 hours per week. So overtime is like 12 hours of overtime. That was regarding the Factories Act. Next is Article number 21. Article number 21 and Article number 45. They both are for giving primary education. Article 21 and Article 45 are for giving primary education. Please remember that Article number 24 of the Indian Constitution, it is for child protection, and no child age less than 14 years can be employed. No employment for age less than 14 years. Then Article number 45 and Article number 21, that is for free primary education. Okay, so please remember this. Article 45 and 21 is for free primary education. Body fat assessment, beta. How do we assess the body fat? Body fat assessment is done using the obesity indicators. Obesity indicators. What are the obesity indicators? How do you check obesity? सर लेटेंट टीबी में हिडन टीबी ही होता है. यस डॉक्टर, अभी लेटेंट टीबी में हिडन टीबी होता है, बट लेटेंट टीबी को वी कैन नॉट चेक बाय सीबीनैट, वी ऑलवेज चेक बाय मॉन्टू टेस्ट. कैंटीन को अभी बाद में बताता हूँ. First tell me, what are the obesity indicators? Any idea what are the obesity indicators? What are the obesity indicators? Any idea you guys have? So I was just searching for the obesity criteria. There we go. Yeah. Beta, what are the obesity indicators? Obesity indicators हमारे पास BMI, that is body mass index. Then we can also have the Broca's index and the corpulence index. ये तीन important indicators हैं. Body mass index, what is the formula? It is weight in kilograms divided by height in meters square. Body mass index is weight in kilograms divided by height in meters square. Apart from this, you should also note other obesity indicators or body fat indicators. The body fat or obesity. The body fat or obesity, beta. Safia Noor, that is ponderal index. Ponderal index is used in children. So we have another indicator, that is ponderal index. Ponderal index is predominantly used in children. It is usually not very commonly used in the general field area. Field mein what we use is these body fat indicators, plus we also use the body mass index. Bas, that's it. So we can use the skin fold thickness. How do we check the skin fold thickness? It is done using Herpenden caliper. Herpenden caliper. So in males, if it is more than 50, total 4 sites mein you will check. In 4 sites combined, if it is more than 50, and in females, if it is more than 40, it is called as obesity. सर आज आप चेयर पे कैसे? बस ऐसे ही यार. अब थोड़े बुजुर्ग हो रहे हैं. So Herpendon's calipers, males more than 50 and females more than 40. Total of 4 sites. Total of 4 sites अगर आप देखें, that is called as obesity in terms of skin fold thickness. Then is waist circumference for males if it is more than 102, and females if it is more than 2 fat lovely ladies 88. Waist hip ratio, if it waist to the hip ratio in males it is more than 1, in females 0.85 से ज़्यादा होगी, it is taken as obesity. These are for body fat or the obesity indicators. These are very frequently asked. It is a 7-star MCQ point. ये काफ़ी दफ़ा एग्जाम में पूछा जाता है regarding the obesity indicators. Okay. लॉरेंस फार्मूला बेटा, यू कैन टॉक अबाउट द लॉरेंस फार्मूला ऑल्सो, बट वो मुझे लगता नहीं है एग्जाम में इतना ज़्यादा पूछा जाता है. इट इज़ अ करेक्शन फैक्टर. सो लॉरेंस फार्मूला, इट इज़ जस्ट अ करेक्शन फैक्टर. कॉर्पुलेंस इंडेक्स के साथ ना एंड ब्रोकाज इंडेक्स के साथ, इट इज़ जस्ट अ करेक्शन फैक्टर. लॉरेंस फार्मूला you don't need to remember, because in that you take gender into account. 2 लेते हैं females के लिए, males के लिए अलग number होता है. So Lorentz formula, you don't need to remember them. These values are in centimeters. Yes. Okay. So beta, these are the areas जहाँ से ना you check for the Herpendens caliper. So you take the calipers and you check from the suprailiac area, suprailiac just above the iliac, subscapular, बाइसेप एरिया एंड ट्राइसेप. सो 2 फ्रंट पे होते हैं सुप्राइलिक एंड बाइसेप्स, 2 बैक पे होते हैं सबस्कैपुलर एंड ट्राइसेप्स. So you just combine these 4 areas, and in males if it is more than 50, and in females if it is more than 40, it is taken as obesity or body fat. Okay. So हमारा body fat भी हो गया. Article 21. Let us go about the relative risk. What is relative risk? Beta, relative risk is what you can calculate from the which studies? Cohort studies. There are 2 types of studies बच्चे. We can have is the case control studies, or we can have the cohort studies. जो case control studies है, please remember case control studies, you start with what? We start with the disease population, and cohort study you start with the risk factor population. So people who have the risk factor and people who are without the risk factor, that is what is cohort. So in cohort beta, you will calculate something called as a relative risk. Whereas in case control studies, we will calculate odds ratio. What is the formula for odds ratio? Odds ratio is given by the formula cross product ratio. It is given by the formula A into D over B into C. That is, अगर ये आपके total disease हैं, disease plus, and this is disease minus, and then on the other hand you have exposure plus and you have exposure minus. So let us say this is A, B, C and D, and that is what is cross product ratio. That is the ratio of this divided by this. A into D over B into C, that is odds ratio. On the other hand, relative risk में क्या होता है? What is the formula for relative risk? Relative risk is nothing but incidence in the exposed population divided by incidence in the non-exposed population. Incidence in exposed divided by incidence in non-exposed, that is what is used in cohort studies. So what is a relative risk? It is incidence in exposed divided by incidence in non-exposed. Next is a few points about ecological studies. What are ecological studies? If you talk about all these study designs, beta, you can see over here cross-section study, ecological, case control या cohort studies. If you talk about all these study designs, थोड़ा सा बड़ा कर देते हैं. Let us keep it this way and maybe that will be much more easier for you. Okay, and और बड़ा कर सकते हैं. Yeah, there we go. So let us talk about these 4 different types of study designs: cross-section studies, ecological studies, case control studies and cohort studies. Beta, this is a total summary table. It is a total summary table, and all these summary tables I have already discussed in the FMG review video which I just showed to you a few moments ago. In this video I have discussed everything, every chapter का summary in just 20-30 minutes. पूरा chapter आपका discuss किया हुआ है. So beta, what you need to remember: high yield points, वो पीछे 27th edition of the park. Absolutely, this is 27th edition of the park. I have total, मैं आपको दिखाऊं अपनी library. I'll show you afterwards. I'll show you my study area. तो देखना चाहोगे मैं कहाँ पढ़ता हूँ? This is my study area. This whole thing is my study area. This whole thing, that's my daughter. And ये मैं जहाँ बैठा हूँ, this is also full of books. And over there, if you want to see, वो हमारा पूरा study area है. We have all my books and everything lying around. So this is my study room. This is my study room. I have यहाँ से मैं किताबें लिखता हूँ बेटा, and यहीं से सारे काम काज होते हैं, यहीं पे पढ़ाई होती है, आप लोगों के लिए तैयारी करते हैं. So this is the summary of everything. ये आपने पार्ट तो देख ली है, ये नहीं देखी. This is the book that you should be taking care of right now. एग्ज़ाम देना है तो ये बेटा, I have tried to tell you that total हमने 37 pages में, in this book, in total 37 pages, I have completed full PSM. In total 37 pages, ये आप देख सकते हैं, total 37 pages is full PSM. Complete PSM is 37 pages. So, yeah, ये आज आपने मेरा अड्डा देखा है, यहाँ से सारे काम काज होते हैं मेरे. चलो beta, this whole summary table I have discussed with you in the previous video session, so you can just see over there. Coming to ecological studies, points for you to remember in ecological study. Bolo mere saath फटाफट से. It's a very quick revision. What is the unit of study in ecological? Say with me. What is this unit of study in ecological study? It is population. What is the unit of study in case control studies, cohort studies? It is unit of study in case control cohort study. It is individual. How do we do ecological? We started by using data sources. What is the other name for ecological? Correlational study. What is the bias? Ecological fallacy. So ecological studies again has been talk of the town. It is very frequently asked in the exam. So FAQ hai ecological study. Please remember, frequently asked topic in your exam. Okay. Circle दिखा दो. Circle पूरा. Very nice. I'll show you sometime. So many students have been asking me मेरा studio कहाँ पे है. ये पीछे मतलब on the other side where ये camera है ना, so behind the camera is my studio. मेरा studio अभी थोड़ा सा बेचारा फंसा हुआ है. So I'll show you sometime. Okay. चलो आज सबका मूड कर गया ये सब देखने का है, पढ़ने का मूड किसी का भी नहीं है. So let's go to the next one. Questions from Kala Azar. 5 points about Kala Azar. 5 points about Kala Azar. Kala Azar, 5 points. Kala Azar. Kala Azar, what is the vector beta? Vector is sandfly. Sandfly, that is Phlebotomus argentipus. Kala Azar, what is the investigation of choice? RK39, what is the drug of choice? It is liposomal amphotericin B. It is liposomal amphotericin B. नहीं बॉस, मैं मैमसी में नहीं पढ़ते हैं, हम मैमसी में नहीं पढ़ते हैं, पढ़ाते हैं, हम मैमसी से ऊपर उठे हुए. So life, of course, with due respect to Mamsi Medical College, so with respect to all the colleges, so I'm not in Mamsi beta. Drug of choice for Kala Azar, that is liposomal amphotericin B. Investigation of choice, that is RK39. Vector is a sandfly. Kala Azar, how do you kill a sandfly? Sandfly is very susceptible to DDT and BHC. DDT and BHC, but we do not use them these days. What we use, what is the best answer? What we use these days, it is synthetic pyrethroids. Synthetic pyrethroids. So ये भी एक कई दफ़ा controversy आ जाती है that what is the insecticides that we use for killing the killing the sandfly or the Phlebotomus argentipus. DDT beta SS पुराना आंसर है. DDT is not the current answer. DDT पहले यूज करते थे, वी डोंट यूज DDT these days. Aldehyde Napier test at community level for diagnosis नहीं. Aldehyde Napier test for community level diagnosis नहीं यूज करते. It is aldehyde test. What is the use of aldehyde test, beta? Aldehyde test. Aldehyde test is used for surveillance. Surveillance. It is not used for diagnosis. It is only used for surveillance. सर 21 को दोबारा लाइव आ जाना, स्टूडियो दिखा देना, आज पढ़ लेते हैं. यस, दैट्स द स्पिरिट. आज फिर पढ़ाई करेंगे. नेक्स्ट इज कालाजार. नेक्स्ट इज live vaccines. What are the live vaccines? Beta, ये मैंने mnemonic I have shared with you many number of times. Cool boy loves crime types. Cool boy loves crime types. How RK39 serology confirmation? It is like that. RK39 is the serology confirmation. Okay, let's go on. Cool boy loves crime type. C for cool, Covishield, that is COVID vaccine. Boy, BCG, OPV, yellow fever. Loves is live vaccines. Crime में C आता है, चिकन पॉक्स एंड कॉलरा की 2 वैक्सीन्स, डुकोरल वैक्सीन and Sankol vaccine. Dukoral and Sankol vaccine, they both are live vaccines. R is rubella vaccine, rotavirus vaccine, influenza vaccine. M is measles and mumps vaccine. E is encephalitis, Japanese encephalitis. Types is typhoid oral 21A. So typhoid oral 21A, Japanese encephalitis की जो live vaccine है SA14-14-2 strain होता है. Japanese encephalitis के ऊपर I would like to give a special mention. एग्जाम में काफ़ी controversy is going around the students. Japanese encephalitis की we have a live vaccine, we also have a killed vaccine. The live vaccine का strain is SA14-14-2. It was used in the national immunization schedule till 2023. But very recently, new update है बेटा. If you get single best answer, please mark the new update. New update is we have started using the killed JE vaccine, that is the Genvac vaccine. We have started using the Genvac vaccine. Genvac vaccine is a kolar strain. ये Indian strain है. It is a kolar strain and it is a killed. Genvac is a killed intramuscular vaccine. It is killed intramuscular vaccine. कहाँ देते हैं? It is given in the anterolateral thigh left side. So Genvac is a new vaccine which we have started giving in India. It is a kolar strain killed intramuscular vaccine, that is for Japanese encephalitis. Measles, what is the strain we use for measles? Edmonston Zagreb strain. Edmonston Zagreb. Mumps is Geril Lin. Influenza, rubella, rotavirus, ये सारी live vaccines है. It is a 100-star MCQ. Immunization, you have to know it by heart. फिर कई दफ़ा controversies आती हैं. Which vaccines are not under open vial policy? पुराना I used to teach you before that मेरा रोता बेचारा जीजा. But now Jija is no more crying, no more rota bichara Jija. It is only bichara main, only main bichara, measles, rubella and BCG. It is only BCG and measles, rubella. These are the vaccines jinme open vial policy is not applicable. If you reconstitute them, you have to use within 6 to 8 hours. Please note, open vial policy is not applicable only to 2 vaccines, that is measles, rubella and BCG. Okay, Genvac for pregnancy में दे सकते हैं. Studies have not yet been done. We don't know about pregnancy status. But yes, technically it's not a live vaccine. Therefore, it can be given in pregnancy. मेरा रोता बेचारा जीजा बेटा, ये पुराना निमोनिक हो गया. छोड़ दो इस निमोनिक को बस. ये ओल्ड हो गया. This is old mnemonic. Now it is only मैं बेचारा. So MR and BCG. Please show killed JE vaccine slide again. Killed JE vaccine slide, kolar strain. Rota comes under open vial. Yes, Rota is now under open vial. COVID भी नहीं है sir. नहीं COVID है. COVID, rabies. So this is beta only for the national immunization schedule vaccine. vaccines which are under the NIS, National Immunization Schedule. COVID नहीं ना है, every child who is born उसको COVID नहीं ना लगाते. So many vaccines do not follow open vial policy. Other vaccines का example दे देता हूँ. Example, rabies vaccine, इसको if you reconstitute, you have to use it within 6 to 8 hours. Then again, for meningococcal vaccines, if you reconstitute, you have to use it within 6 to 8 hours. इसके बाद yellow fever vaccine you have to use within 2 hours. Then you have बहुत सारी vaccines है, COVID vaccines है. There are many vaccines which are not under open vial policy. But इनके ऊपर I don't think there will be MCQ. You can just omit this. इसको पढ़ने की ज़रूरत नहीं है. This you should be remembering, the National Immunization Schedule vaccines which do not follow the open vial policy. Right? ये बता तो दिया सर एक बार ओपन वायल पॉलिसी. ये यही तो बता रहा हूँ, ओपन वायल पॉलिसी. गुड इवनिंग राहुल, आप लेट आए. मिस्टर बोन मैरो, क्या बात है. चाचा फॉर कोविड, मेरा बेचारा चाचा रोता, मेरा रोता बेचारा चाचा. नहीं बेटा, रोटा वायरस इज नॉट अंडर ओपन वायल पॉलिसी. रोटा वायरस इज नाउ अंडर द ओपन वायल पॉलिसी. Okay, live vaccines हो गया. Communicable disease transmission, very frequently it is one of a 5-star MCQs. This is a 5-star MCQ. What are the communicable disease transmission modalities? So communicable disease transmission, it can be direct transmission or we can have indirect transmission. Please remember the direct transmission, you can remember it as DTIX. You can remember it as DTIX. Indirect transmission, you can remember it as favorite ultraviolet, FAVUV, favorite ultraviolet. D stands for the droplet, T is transplacental, I is inoculation, C is contact, S is soil. गलती यहाँ पे करते हैं स्टूडेंट्स, सॉइल ट्रांसमिटेड को उन्हें लगता है, दे थिंक सॉइल ट्रांसमिटेड इज इनडायरेक्ट. नो, सॉइल ट्रांसमिटेड इज डायरेक्ट ट्रांसमिशन. गलती यहाँ पे करते हैं, दे थिंक airborne mode of transmission is direct. No beta, airborne mode of transmission is not direct, it is indirect. Next is गलती यहाँ के करते हैं, what is vehicle borne? Can you write it in the chat box? What is vehicle borne? So what do you mean by the vehicle borne? हाँ, PSM आज खत्म करते हैं हेमंत गुर्जर. Yes, absolutely correct. So yes, this is for FMG. All those who are joining in now, this is for FMG students. What I am doing right now, beta, it is all 6 years of FMG. 6 साल के पुराने topic wise discussion I am doing. So all the years 2018 till 2023. So I'm discussing all the 2018 till 2023 MCQs, direct and indirect mode of transmission. So please remember, what is vehicle borne? ये लिखना है आपने. Vehicle fomites, no. Typhoid fly, no. This is wrong answer. You guys are giving wrong answer. Vehicle contaminant, no. You all are giving wrong answers. गलत बोल रहे हैं आप लोग. फोमाइट तो अलग होता है ना बेटा. फोमाइट का तो नाम अलग है ना, एक्स्ट्रानो. शशि भूषण, ये फोमाइट बॉर्न तो अलग होता है. फोमाइट आर इन नॉन लिविंग एनी ऑब्जेक्ट्स. व्हीकल बॉर्न कौन सा होता है? व्हाट आर व्हीकल बॉर्न? इट इज फूड बॉर्न, waterborne, bloodborne infections which are transmitted by these food, water and blood. That is what is vehicle-borne infections. That is what is vehicle-borne infections. Okay, so don't get confused. Okay, feces-borne, food-borne, all these are vehicle-borne infections. Right? Very frequently asked to you in your exams. प्लीज़ रिमेंबर विच इन्फेक्शंस आर एयरबॉर्न. एयरबॉर्न कौन से इन्फेक्शंस होते हैं, ये भी एग्जाम में पूछते हैं. एयरबॉर्न कौन से होते हैं? इट इज़ चिकन पॉक्स, एयरबॉर्न इन्फेक्शन. एयरबॉर्न इन्फेक्शन, इट इज़ चिकन पॉक्स. देन वी ऑल्सो हैव tuberculosis. Then we have measles, influenza or SARS virus. So influenza or SARS virus, measles, tuberculosis, varicella, chickenpox, all these are airborne mode of infection. ना एग्जाम में आप आंसर गलत कर ही नहीं पाओगे. Just make sure that whatever I'm telling you, these all topics you have to remember by heart. Next is hardness of water. What do you mean by hardness of water, beta? Hardness of water is by two types. Hardness of water is by two types. हार्डनेस दो किस्म की हो सकती है. वी कैन हैव टेम्पोररी हार्डनेस और वी कैन हैव परमानेंट हार्डनेस. बस एक ही सवाल याद रखना है. टेम्परी हार्डनेस इज बिकॉज ऑफ व्हाट? टेम्परी हार्डनेस इज बिकॉज ऑफ कैल्शियम मैग्नीशियम. बोलो मेरे साथ, कार्बोनेट और बाइकार्बोनेट. इट इज बाइकार्बोनेट्स. Please note it is not carbonates. Calcium, magnesium, bicarbonates. The permanent hardness is because of the calcium, magnesium sulfates, and it is because of the phosphates. Calcium magnesium sulfates and calcium magnesium phosphates. That is what is temporary and permanent hardness. How do you treat hardness? Treatment of hardness can be done by boiling. We can also add lime. We can also use the permutate method. बस इनके नाम याद रखो. We can use lime. You can boil the water, or we can use the permutate method. Very nice. Okay, so make sure you get about the hardness of water. What is the normal hardness? What is the normal hardness of water? We drink 1 to 3 milliequivalents of hardness. 1 to 3 milliequivalent of hardness होनी ठीक रहती है. It should be between 1 to 3. Less than 1 यदि हो जाए, it is called as soft water. More than 3 हो जाए, it is called as hard water. So what we drink is moderately hard water. What we use for drinking, it is moderately hard water. What we use for drinking is moderately hard water. Next is, what do you mean by the secondary attack rate? Beta, what is secondary attack rate? Secondary attack rate, it is the number of secondary cases divided by the total susceptible population minus the primary case into 100. Minus the primary case into 100. ये आपसे 4 to 5 times पूछा गया है एग्जाम में. ये पुराना घिसा हुआ क्वेश्चन है. What is secondary attack rate? Secondary attack rate of chickenpox, of measles. Secondary attack rate of chickenpox and measles, it is roughly around 80 to 85%. It is very high secondary. अगर इन दोनों में से पूछा जाए कि किसका ज़्यादा है, chickenpox या measles, answer has to be for chickenpox. Chickenpox has very high secondary attack rate, even up till 90%. So chickenpox अगर unimmunized बच्चा है, susceptible बच्चा है, chickenpox spreads very rapidly. That was regarding the secondary attack rate. Next is biomedical waste, regarding where will you discard needle. So where will you discard needle? Where will you discard the needle of cannula? Bolo fatafat se. Where will you discard the needle of cannula? Please remember that biomedical waste, you have these 4 categories: the yellow category, the red category, the blue and the white category. If you talk about the yellow category, beta, if you talk about this yellow category, please remember yellow के अंदर we will dispose of everything. आपके जो भी doubts हैं biomedical के, please ask me right now. Attack का definition एक बार बता दें. So attack rate I will tell you later. Where will you discard the needle? Absolutely correct, everybody. Absolutely correct. Needle is disposed of in the white category. Needles are disposed of in the white category. येलो के अंदर सब कुछ जाएगा. I'll just name them: human anatomical waste, placenta, fetal, soiled waste. What is soiled waste? It is all the dressing trolley waste. ड्रेसिंग ट्रॉली वेस्ट, जितनी भी बैंडेजेस जाएंगी, कॉटन बैंडेजेस, माइक्रोपोर, एवरीथिंग, प्लास्टर, कास्ट, फेस मास्क, शू कवर, हेड कैप, everything it is soiled waste. Okay, everything it is soiled waste. Discarded bedding and linen will go to yellow category. Expired medicine, cytotoxic drugs, microbiological drugs and microbiological waste and blood bags, they all go to the yellow category. कुछ क्वेश्चंस आए हैं स्टूडेंट्स के. पंचर प्रूफ बिन, येस इट इज़ अ वाइट पंचर प्रूफ बिन. अभी पूछ रहे हैं कल्चर प्लेट एंड मीडिया. बेटा कल्चर प्लेट्स with media they go to the yellow category. They go to the yellow category. Soiled gloves, every type of glove. So if there is blood in gloves, beta Sneha and Chandan Kumar, आपका एक ही doubt है. If you are disposing of gloves, if you are disposing of gloves has to be disposed of in the red category. Can you see over here? Gloves have to be disposed of in the red category. Heavy duty rubber gloves. So they are with blood, without blood, stained, not stained. It is heavy duty gloves will always go into the red category. Vacuumers, अगर empty vacuumers होंगे, अगर empty vacuumers होंगे, they will go to the red category. But अगर blood in vacuum होगा, if there is blood in vacuum, that is they become non-sterile. In blood and vacuum, they go into the yellow category. Okay, culture plate without media तो plate हुई ना, वो तो फिर glass हुआ ना बेटा. Okay, without media, so it's just a glass will go into the blue category. So empty vials, broken ampoules, broken glass, any type of glass, broken glass, it has to be broken glass, it will go to the blue category. All the sharps, they go to the white category. Okay, all the sharps will go to the white category. Where to dispose NBE? NBE, it is a general municipal waste. It should be disposed of in the municipal category. वो मेरे को बाहर निकाल दे, मेरे लाइसेंस जब्त हो जाएगा तुम लोगों के चक्कर में. So sorry NB, हमने ऐसा नहीं बोला, किसी ने नहीं सुना. And but it's just because के I feel pity, I feel bad about the students कि इतना पढ़ाई किया. प्लीज़ आंसर माई क्वेश्चन. सर अभिनंदन, आप प्लीज़ अपना क्वेश्चन दोबारा पूछें, मुझे कहाँ से दिखेगा ना. क्लॉथ, अच्छा सॉरी, आई फाउंड योर क्वेश्चन. क्लॉथ यूज फॉर फूड डिस्कार्डेड बाय पेशेंट. Cloth used for food discarded by, beta, food is always a general category. Food is never taken as biomedical waste. Leftover food, it is always taken as general waste. It is always taken as general waste. Irretractable needles with syringes, also in white. Yes, that is correct. So it is needles from syringes and syringes with fixed needles. They go into the white category. They go into the white category. Okay, so कुछ और डाउट्स अगर आपके हैं तो पूछिए आप. बेटा प्लीज नोट, इंट्रायूट्राइन डिवाइस they will go to the red category, not the yellow category. Intrauterine devices are plastic, they are disposed of safely in the red category. Then we have questions from pacemakers, ECG electrodes. Pacemaker जो है, because it contains battery, it is returned back to the manufacturer. ECG electrodes, it is black color category, it is general waste. Okay, blunt trocars, any type of trocars will go into the metal waste, that is the white category. Any waste, metal waste will go into the white category. Blunt trocars, metal waste, it goes into the white category. संचित पूछ रहे हैं, वैक्यूटेनर्स इफ ओनली कंटामिनेटेड, नो मेंशन ऑफ ब्लड, व्हाट टू डू. यूजुअली कंटामिनेटेड वैक्यूटेनर में, देखो वैक्यूटेनर में मतलब व्हाट आर यू गोइंग टू पुट इट. स्टूल तो जाएगा नहीं, फीसेस तो जाएगा नहीं, यूरिन भी नहीं जाएगा, CSF भी नहीं जाएगा. सो व्हाट आर यू गोइंग टू पुट? वी आर यूजुअली गोइंग टू हैव इट विद ब्लड or blood products. It has to be when we say contaminated or non-sterile, it's not a very correct word, but generally speaking, answer has to be the yellow category. Okay, so broken vial, vaccine vial, blue, right sir? Yes ma'am, yes. Nivedika, yes, broken vial लिखा तो हुआ, empty vial, broken vial, so it is blue category. चले आगे बेटा. ब्लड, ये बायोमेडिकल वेस्ट हो गया आपका. निक्षय इज यूज फॉर, सबको पता होना चाहिए, निक्षय इज यूज फॉर ट्यूबरकुलोसिस नोटिफिकेशन. Nikshay is used for TB notification. Next is couple protection rate. What do you mean by couple protection rate? Beta, what is this couple protection rate? Couple protection, अगर दो definition आ जाए, sir, what about cotton swab like samples taken from COVID? Rishu Grover is asking about sample taken from COVID, cotton swab. So dressing trolley waste किया ना आपने, it will go to the yellow category. नेक्स्ट पृथा पूछ रहे हैं मेटल स्क्रूज एंड पिन्स फॉर ऑर्थो सर्जरी, लिखा है ना बेटा यहाँ पे, मेटालिक बॉडी इम्प्लांट स्क्रूज एंड प्लेट्स, इट गोज टू द ब्लू कैटेगरी. ओके, सो ब्लू ब्रोकन वायल इज ब्लू, सॉलिड वेस्ट येलो में. यस आई नो, पुराना कैटेगरीज आईयूडीज वॉज पुट एज सॉलिड वेस्ट. हरमोहन चौहान इसको अपडेट कर लीजिए. प्लीज नोट आई यूज टू टीच इट एज येलो कैटेगरी एंड recently government of India has clarified it has to go into the blue, it has to go into the red category, the IUDs. Euro bag and blood bag. स्नेहा पूछ रहे हैं यूरो बैग्स एंड ब्लड बैग्स. प्लीज नोट, यूरो बैग विल गो टू द रेड कैटेगरी, ब्लड बैग विल गो टू द येलो कैटेगरी. कैसे याद रखोगे? ब्लड कौन से रंग का होता है? लाल होता है, तो वो किस में जाएगा? येलो में जाएगा. यूरिन कौन से रंग का होता है? वो येलो होता है, तो वो किस में जाएगा? रेड में जाएगा. यूरिन इज येलो, दे गो टू द रेड. ब्लड इज रेड, इट गोज टू द येलो. दे ऑल विल गो एंड क्रिस क्रॉस, दे नेवर गो टू देयर सेम कलर्स. याद रख लो इस तरीके से. सर व्हाट अबाउट कॉटन स्वैब्स? वी हैव डिस्कस कॉटन स्वैब इज येलो, metal screws and pin is blue. Similar question was in marrow, answer was red. Yes, IUD is in red, but it has been updated now. Government of India has clarified on this. Earlier there was discrepancy. Some guidelines used to say red, some will used to say blue also. AIMS people used to say yellow. But now Government of India has clarified it is a red category. How to remember treatment and disposal for biomedical waste? कुछ ज़्यादा नहीं याद रखना. You just remember the categories for now. Okay? And that's it. लाल पीला लाल, रेड इज नॉट रेड. यस, ठीक है. चलो, कपल प्रोटेक्शन रेट. लेट्स टॉक अबाउट द कपल प्रोटेक्शन रेट. बेटा अगर ये डेफिनेशन आ जाए, व्हाट डू यू टॉक अबाउट डेफिनेशन नंबर 1? ये क्या चीज़ है? couple in which the female is in reproductive age. What is this definition? Target couple or eligible couple? क्या बोलना चाहते हो? A couple in which the female is in reproductive age group. A couple in which the female is in reproductive age group. What do you want to say? Couple in which the female is in reproductive age group. This is called as eligible couple. This is called as eligible couple. Next, a couple who has completed family and has at least one live child. A couple who has completed family and has at least one live child. ये कौन सा है? This is what we call as a target couple. Target couple. So beta, target couple is a couple who has completed family and has at least one live child. So what do you mean by couple protection rate? It is the number of couples, number of target couples or the eligible. What do you want to say? Number of eligible couples who use contraceptive methods. Contraceptive methods. Please remember, number of eligible couple who use contraceptive methods is what we call as couple protection rate. So what are the targets under Government of India? The targets for the National Family Planning Program, the targets for the National Family Planning Program is to have a couple protection rate of more than 60%. अगर ये होगा, then the total fertility rate of India will be less than 2.1, and if TFR happens to be less than 2.1, we will say that the NRR for the country will be equal to 1. NRR for the country which is equal to 1, this is what we call as replacement level. This is what we call as a replacement level, NRR equal to 1. So what do we want to achieve? We want to finally achieve the NRR for the country to be equal to 1. To achieve NRR 1, the TFR to be 2.1. To have TFR 2.1, the couple protection rate should be more than 60%. It should be more than 60%. So India may, we are giving incentive to the ASHA worker. This can be asked as prospective probable MCQ. It is a probable MCQ that how much incentives we are giving to the ASHA workers. Please note that the ASHA worker will get 500 rupees agar wo baby is delayed for 2 years after marriage. Another 500 if the second baby is delayed for 3 years after the first child, and another 1000 rupees if the couple adopts any permanent method of family planning. So what is this called? This is what we call as a planned family. What is this? This is what we call as planned family. Beta, this is a probable MCQ. You should know that how much is the incentive given to the ASHA worker for having a planned family in the village. ASHA worker को 1 rupee for 3 condoms, 5 rupee for OC pills, 5 for I pills and emergency contraception भी मिलता है. Okay, so that was a quick review about couple protection rate. Case control studies advantage. We already know what is the advantage of case control. It is less time taking. It is always less time taking. What is the study of choice? What is the study of choice? यहाँ पे भी बात आती है. What is the study of choice for rare disease? What is the study of choice for rare disease? It is a rare disease. It is a case control study. For rare risk factor, it is a cohort study. Okay. For rare disease, it is a case control. For rare risk factor, it is cohort. I would also like to tell you that case control, it is also a study of choice when you want to assess multiple risk factors for a disease can be assessed in case control, whereas multiple outcomes for a risk factor can be assessed in cohort studies. Okay, so ये दोनों उल्टी चीजें होती हैं. Make sure you get this question right. It is a frequently asked question. ये बहुत दफा पूछा गया है. Study of choice for rare disease, study of choice for rare risk factors. एक बच्चा हमारे पास, एक बच्चे ने nested case control आंसर किया. बेटा, what is a nested case control? Rare investigations or expensive investigation. Okay, यहाँ पे the study of choice is a nested case control study. It is a nested case control study. Nested case control study. Okay, so please don't get confused. Case study of choice पूछा है for rare disease, it is case control. Rare risk factors is cohort. Rare expensive investigation, it is nested case control. Okay, nested case control for Pritha. Very nice, bache. Pritha is absolutely correct, beta. Nested case control, it is a rare expensive investigations. Very good. Next is frequently asked diarrhea management. I do not want to get into diarrhea management, otherwise हमारा 1 hour लग जाएगा. So diarrhea management बेटा आपको pediatric से ज़रूर पढ़नी है. It is a 100-star MCQ. You will get a question on diarrhea management under IMNCI. इंटीग्रेटेड मैनेजमेंट ऑफ न्यूनेटल चाइल्डहुड इलनेसेस. डायरिया की मैनेजमेंट आपको ज़रूरी पढ़नी है. इट इज़ यू हैव टू रीड डायरिया मैनेजमेंट. इट इज़ वेरी वेरी इंपॉर्टेंट. डायरिया इज़ वेरी वेरी इंपॉर्टेंट फॉर यू गाइज टू रीड. वेरी वेरी इंपॉर्टेंट. इस पूरे में से अगर एक क्वेश्चन आपको पढ़ना है, यू शुड स्टडी द डायरिया मैनेजमेंट. जस्ट अ वेरी क्विक रिव्यू अबाउट डायरिया. बेटा डायरिया में दिस इज व्हाट वी फॉलो एज द IMNCI protocol. This is what we follow as the IMNCI protocol. So under IMNCI protocol, you can have no dehydration, some dehydration, severe dehydration. How do you assess no dehydration and dehydration? इन दोनों में क्या फ़र्क है? Generally speaking, अगर बच्चा हंस खेल रहा है, if the child is playful, it is no dehydration. If the child is irritable, it is some dehydration. If the child is lethargic, it is severe dehydration. ये जो मैंने सर्कल किए हैं, ये आपके 100% की वर्ड्स हैं. You cannot have a lethargic child with no dehydration. Okay, so lethargic child, it has to be severe dehydration. Irritable और बच्चा अगर पानी मांग रहा है, drinks eagerly, that is a very पक्का साइन. इट इज 100% साइन ऑफ सम डिहाइड्रेशन. बट लेथार्जिक बच्चा है, कुछ नहीं कर रहा, आराम से बैठा हुआ है, दैट इज प्रॉब्लम साइन, दैट इज सिवियर डिहाइड्रेशन. सो व्हाट डू यू डू इन नो डिहाइड्रेशन, सम डिहाइड्रेशन? यू हैव प्लान ए, देन यू हैव प्लान बी एंड देन यू हैव प्लान सी. प्लान सी में IV फ्लूइड्स देते हैं. प्लान बी के अंदर वी गिव ORS, यूजली स्टार्टेड एज 75 ml पर kg के बेस पे हम ORS शुरू करेंगे. 75 ml पर किलोग्राम के बेस पे ORS शुरू करेंगे. IV fluids has to be given in plan C, and plan A we give generally home based diets and give fluids and treat diarrhea and proper उसको nutritional counseling रहेगा. So that's just a very gross principle. I'm not getting into it, but yes, एक चीज़ आपको ज़रूरी पढ़नी है. in India ये बहुत frequently students get problem बेटा. A lot of times you guys have confusion on this कि India में we use Rizomyl या standard ORS या reduced osmolarity, and many times students say that sir reduced osmolarity and Rizomyl they are same. अरे नहीं भैया, reduced osmolarity is not Rizomyl. Rizomyl is something else. Rizomyl is not used in India. Standard ORS is not used in India since 2005 or 6 onwards. We have started using only one and only one, that is reduced osmolarity ORS. In India we use only reduced osmolarity ORS. ये दोनों Rizomyl and standard ORS India में use नहीं होते. Okay, let us be very clear on this. Okay, so please remember that what we use in India, it is a reduced osmolarity, 75 glucose, 75 sodium, 20 potassium, 65 for chloride and 10 for citrate. What is the use of citrate? ये पूछते हैं. It makes the ORS stable. Citrate, why do we use it? Like citrate, what's the use of citrate? Citrate makes the ORS powder form more stable, and citrate also decreases the stool output. It decreases the stool output. It actually increases the water reabsorption in the intestines. So citrate ulta chalta hai. Citrate will reabsorb the water again, and it decreases the stool output, and it makes the ORS solution more stable, and that's the reason we use citrate for. Okay, glucose, sodium, potassium, ये तो सब electrolytes चाहिए ही होंगे. Glucose, sodium, potassium, chloride, and of course we have this milliosmoles. It has been asked hundreds of times. What is the osmolarity of the ORS? It is 245 milliosmoles. Yes, Rizomyl is not used specifically for general diarrhea cases. Rizomyl you can use for severe acute malnutrition. Very frequently asked in your exam. Okay. नेक्स्ट इज अ फ्यू क्वेश्चंस ऑन पी वैल्यू. ये पी वैल्यू क्या चीज़ है? ये इतना ज़्यादा आपको दिमाग नहीं लगाना. यू डोंट नीड टू बैंग योर हेड. पी वैल्यू, इफ़ यू टॉक अबाउट पी वैल्यू बेटा, स्टैटिस्टिक्स में वी यूज पी वैल्यूज. P value, if it is less than 0.05 or it could be more than 0.05. If it is less than 0.05, it is called as significant P value. Okay, if the P value is less than 0.05, it is called as significant P value, and if it is more than 0.05, it is called as a non-significant P value. In non-significant P value, what are we going to do? You are going to accept or reject a null hypothesis. We are going to accept the null hypothesis. The null hypothesis को आप accept करेंगे, and we call it as H0. So you accept the H0, that is the null hypothesis. Will you say the effect is found? There is no effect of the drug or the intervention. कोई effect नहीं मिलता. But if the p value becomes as significant, if the p value comes as significant, यहाँ पे you will reject the null hypothesis and the effect is observed for the drug. Effect is observed for the drug, that is about the p value. Just remember, p value यदि 0.05 से नीचे है, if it is less than 0.05, it is called as significant. If it is more than 0.05, it is called as non-significant p value. Next is immunization of measles. Beta, when do we immunize for measles? Everybody must be knowing this. फटाफट से बोलो मेरे साथ. Everybody must be knowing this immunization schedule, right? Everybody must be knowing this immunization schedule. What is the immunization schedule, beta? Immunization schedule, you have this updated immunization schedule where the new thing which is added is FIPV3. Fractional inactivated polio vaccine has been newly added at 9 months of age. This is what you have as the updated immunization schedule. So when do we give the measles rubella vaccine? Measles rubella is given in 2 doses. Measles rubella is given in 2 doses. Measles and rubella, one is given at 9 months of age and the second is given at 16 to 24 months of age. One very bekar MCQ, घिसा हुआ MCQ they asked was, when do you give measles rubella? Is it given when the child is just touched the 9 months? completed 8 months or is it completed 9 months? Please note it is completed 9 months. When the child has completed 9 months, at that time we say that the child is 9 months of age. When do we say a child is 1 year of age? When the child has completed 1 year or the child is born, we say the child is 1 year of age. Common sense, yeah, this is such a stupid MCQ. It was asked just 2023, I think. They asked, like, for measles vaccine, when will you give 8 completed months, 9 completed months? So answer is 9 completed months we give the measles rubella vaccine. BMI lethal value. Yes, this is an interesting question. What is the lethal value for body mass index? Please note that the lethal value for BMI, we have already discussed BMI, right? We have already discussed BMI, general values of body mass index for Asian population. You have to note it is normal values. It is 18.5 to 22.9. That is the normal value for Indians. When do we say lethal? Lethal is less than 13. Usually BMI less than 13, it is taken as lethal. Less than 13, it is not compatible to life. And then more than 30, it is called as obese grade 2. More than 40, it is taken as obese grade 3. So that is what it is called as morbid obesity, where the morbid obesity becomes a disease. No more it is a risk factor. Obesity becomes a disease, and that is what is the obesity grading phase 3. So the lethal BMI, please remember, lethal BMI is stage, you can say 0, where the BMI is below 13. Which vaccine? That's a very good question, Phoenix. Which are the vaccines which are not to be given when the child has any fever or any acute illness? During any acute illness, if a child has any acute illness or fever, in these cases, acute illness or fever के cases में usually vaccine is postponed. No vaccine is given during acute fever, acute और high grade fever. But अगर mild fever है, diarrhea है, then all vaccines are given. All vaccines can be given. Only exception with diarrhea is OPV vaccine. OPV vaccine, in case the child has profuse diarrhea, in case the child has very higher amount of diarrhea, then, and if you are giving OPV vaccine, then you need to repeat the OPV vaccine. Repeat the OPV vaccine after 4 weeks in case you are giving OPV to the child. Okay. Postpone for till the time बच्चा ठीक नहीं होता भाई मेरे. So Mudit Garg, till the time bacha is out of the acute illness. Somebody is having seizures. You want to tackle the seizures or you want to give a vaccine, measles rubella vaccine? Common sense, no, we are going to tackle the fever. Next is, what are the non-parametric tests? Last point, what are the non-parametric tests? Non-parametric test. Beta, non-parametric test, these are used as test of significance. So the non-parametric test for single group, it is called as a Mac-Nemer test. For 2 groups, we call it as a chi-square test. And for 3 groups, we call it as a Kruskal-Wallis test. अगर आपको एग्जाम में सिंगल नंबर याद रखना है, ऑलवेज रिमेंबर chi-square test. ये तीनों में, in all 3 situations, you can use chi-square test. So for non-parametric test, you can remember only one answer, that is a chi-square test. When do you say a non-parametric? Non-parametric hoga when you are talking about the qualitative data. Do you remember in biostats we have already talked, data can be quantitative, it can be qualitative. If the data is qualitative, that you are talking in percentages. Agar MCQ is saying that I want to compare the percentage of people who are smokers and non-smokers, percentage of people who are obese and non-obese, इनको अगर आप compare कर रहे हैं बेटा percentages को, that is what is a qualitative data. In qualitative data, what is the best test which we use? We call it as a chi-square test. अगर quantitative data हो, quantitative data where you are talking about numbers like which you can measure, like the height, the weight, the sodium levels, potassium levels, and so on, hemoglobin levels, अगर आप इन चीज़ों को मेजर कर रहे हैं, दैट डेटा इज अ क्वांटिटेटिव, एंड उनमें व्हाट इज द टेस्ट ऑफ सिग्निफिकेंस वी यूज अ पैरामीट्रिक टेस्ट. इन सिंगल ग्रुप बेटा, इन सिंगल ग्रुप वी यूज अ पेयर्ड टी टेस्ट. In single group, we use a paired t-test. In two groups, we use unpaired t-test. In two groups, we use unpaired t-test, and in three or more groups, we use the analysis of variance, that is the ANOVA test. This question has been asked like 3 to 4 times. It is a 3-4 star MCQ frequently asked in your exam. What are the different tests of significance? The test of significance can be parametric, can be non-parametric, and single group, two groups, or 3 or more groups. Mean t-test parameters. Yes, absolutely correct. Very nice, very nice. Harishikesh. Very nice, very nice. इनोवा नहीं है, इनोवा तो गाड़ी है ना बेटा, अनोवा है ये. इनोवा तो कार होती है, ये तो अनोवा है. इट्स नॉट इनोवा. इनोवा तो लेके जाना पड़ेगा कहीं घूमने फिरने. दिस इज अनोवा, नॉट इनोवा. ओके, 3 और मोर ग्रुप. जब ज़्यादा लोग होते हैं तो इनोवा में जाते हैं ना, ऐसे याद कर लो. दैट्स अ गुड निमोनिक. अगर ज़्यादा लोग होते हैं तो इनोवा चाहिए ना, है ना, जब ज़्यादा लोग हैं. सो खुले खुले जाएंगे. सो यू कैन रिमेंबर इनोवा एज अनोवा. सो मोर नंबर ऑफ ग्रुप्स वी यूज अनोवा टेस्ट. ओके, चलो, दैट्स इट फॉर दिस पेपर. इसके अलावा कुछ और है. RDA फॉर द लैक्टेटिंग वुमेन. So what is the RDA, recommended dietary allowance for the lactating females? RDA for the lactating females. Autocorrect हो गया. So RDA for the lactating females, iodine के लिए, what is the amount which is required by a lactating females? How much iodine is required by lactating females? By lactating females बेटा, by lactating females, how much iodine? Iodine एक ऐसी चीज़ है, iodine is required in 150 micrograms, adequate number in all male or female. It is same answer. Then in pregnancy it increases to 250, 150 बढ़ के 250, and lactation में वो 300 के करीब पहुंच जाता है. 280 micrograms per day is required. So similarly for iron beta, I would like to point out over here all the students who have studied from me till 2022. अगर आपने मेरी क्लासेस 2022 में लगाई थी, वहाँ पे आई यूज टू टेल अबाउट 40 मिलीग्राम्स फॉर आयरन बेटा. ये आयरन का नंबर अभी गवर्नमेंट ऑफ इंडिया ने अपडेट किया है. In pregnancy, we do not need higher iron. In pregnancy, it is said because the female is having amenorrhea, plus उसको government of India ऊपर से iron folic acid tablets भी दे रहे हैं. The iron which is required during pregnancy, it is only 27. In females non-pregnant, it is 29. In pregnancy, it is 27. In lactation, it is still lesser. It is 23. Why? Because the female is not menstruating. So please note that non-pregnant state it is 29, pregnancy it is 27, 23, and ये update है. This is update for all the students who have studied about the iron in the previous classes. Okay, so that's what you need to remember for iron and iodine. That's what you need to remember for iron and iodine. Let us go to the next MCQs. So today we are going to discuss these 50 MCQs, 50 points today for now, and remaining we will take in the next section. Although इनमें से काफ़ी कुछ तो आप already कर चुके हैं. So in 2019 they asked these next points. So we are continuing these topics. Today I'll be discussing 46 total points. What do you mean by component bar chart? So in 2019 they asked about this component bar chart. What is this component bar graph? So if you look at the component bar graph beta, component bar graph, this is what we have as the multiple bar graphs. This is what we have as the multiple bar graphs. Beta, what is this graph type called as? What is this graph type called as? This graph is what we call as a multiple. This is what we call as, not multiple. This is what we call as a component bar chart, bar graph, or bar chart. Or we can also call this as a stacked bar chart. This is also called as a stacked bar chart or a component bar chart. Now, what is a multiple bar chart? This is what we call as multiple bar charts. Multiple bar charts are where there are multiple things. So bar charts, they are used for qualitative data. Bar charts, they'll be used for qualitative data, and multiple bar charts are these types of bar charts. So these iron levels are so controversial, different in PSM and OBG. Nah beta, they are not different in PSM and OBG, they are same. So these iron levels, they are same in OBG and PSM, they cannot be different. अगर आपको difference लगता है, you need to follow what is Government of India thing. So this is what is confirmed thing beta. And till the time abhi session chal raha hai for next 30 minutes, at least 30-40 minutes. And if you can get the thing, get the screenshot of that, you can just post it to the Telegram group, and wahan se I can see, and we can discuss, right? Okay, so in case you have any controversy, you can post it on the Telegram beta Pritha. So that was for you. Of course, this is a session where I wanted to discuss with you. So the kuch questions hai, can I ask? Yes. Yes, PDF मिलेगा आपको, ये वाला PDF I will be sharing in the Telegram group. So component bar chart, beta, what is a component bar chart? Component bar chart is something like this. This is different. This component bar chart is also called as a stacked bar chart. It is different from a multiple bar chart. Next in line, what is triage color coding? Triage color coding, beta, I hope everybody knows about this triage color coding. We have the black category, the red category, the yellow category, and the green category. Black category is for dead patients or moribund patients. Red category, they need immediate attention. They need immediate attention. Yellow category, they need immediate attention. They need immediate attention. Red is something like, we call it as urgent medical attention. Green is ambulatory patients who can wait. Ambulatory patients who can wait. Generally talking, there is no single clear-cut answers, but generally talking, red person will wait for few minutes, usually 30 minutes to an hour, 30 to 60 minutes. The yellow can wait for few hours, and green can wait for few days. There is no single answer के ये 30 minutes है, sir ने 60 बताया है, somebody else is saying 15 minutes, somebody is saying 2 hours, ऐसा कुछ नहीं है. There is no single best answer on how do you categorize red, yellow and green. But generally speaking, up to 30 few minutes you can say is red category, few hours, 3 to 4 hours is yellow category, and green is person who can stay for much longer days, ambulatory patient. Group discussion number, beta. How many people should be there in a group discussion? There should be 6 to 12 persons in the group discussion. Less than 6 people don't talk, more than 12 people keep on fighting. The ideal number of group discussion is 6 to 12. Next is, what do you mean by paradoxical carrier? What is a paradoxical carrier, beta? What do you mean by a paradoxical carrier? Paradoxical carrier is nothing but a healthy carrier. It is nothing but a healthy carrier stage. Paradoxical carrier is a healthy carrier. Paradoxical carrier or healthy carriers, they arise from non-virulent strain. They arise from non-virulent strain, or they arise from subclinical cases. So subclinical cases, technically they should not have been transmitting, but sometimes the subclinical case may transmit, and that is the reason we call these carriers as healthy carriers or the paradoxical carriers. We call them as healthy carriers or paradoxical carriers. It has been asked n number of time in your exam, what are the examples of healthy carriers? Healthy carriers is community medicine is DPT, cholera, meningitis, diphtheria, pertussis, and tetanus. Cholera, meningitis, diphtheria, pertussis and tetanus. ये बहुत दफ़ा it has been asked multiple times in your exam that is what is paradoxical carrier. सर 20 से पहले फिर सब क्वेश्चंस ईयर्स के क्वेश्चन कवर नहीं होंगे. 20 से पहले करेंगे ना. I'll probably come again, maybe tomorrow we can do it, right? Rather than just training your brain today only. So we can do these MCQs tomorrow at the same time. Okay, जो remaining MCQs हैं we can do it in part 2. आराम से हो जाएंगे, जल्दी हो जाएंगे, because we have already done major chunk epidemiology. We have already done. We are not going to talk about these points again and again. Next is, what is the PEP for HIV, beta? What is the PEP for HIV? PEP, what does PEP stand for? PEP stands for the post-exposure prophylaxis. PEP stands for the post-exposure prophylaxis. The drug of choice for PEP. The drug of choice, HIV की बात कर रहे हैं. The drug of choice for PEP, that is post-exposure. Okay, it is TLD only. What is TLD? Tenofovir, lamivudine and dolutegravir. याद रखना, tenofovir, lamivudine and dolutegravir. This tenofovir, lamivudine, dolutegravir, it is to be given as one tablet every day. It is to be given for 28 days. It is to be given for 28 days. मोहम्मद सैफ, सर प्लीज सेंड PDF. अभी भेज दूं या लिख लूं फिर भेजूं भाई? मेरे मिल जाएगी, आप सबको मिलेगी. Okay, so the drug of choice for post exposure, it is TLD. What is the drug of choice for prophylaxis of pneumocystis jirovecii? Pneumocystis jirovecii pneumonia, it is TMP SMX. What is TMP SMX? That is trimethoprim and sulfamethoxazole double strength tablet. ये जाती है as prophylaxis of pneumocystis jirovecii. And next is, what is the DOC for pre-exposure prophylaxis? For pre-exposure prophylaxis, beta, this is what is a probable MCQ. Probable MCQ for this year, pre-exposure prophylaxis. Government of India ने very recently guidelines निकाले हैं. The drug of choice for pre-exposure prophylaxis, it is tenofovir plus either we can give emtricitabine, or we can also give lamivudine. So या तो we will give tenofovir plus either emtricitabine or we give lamivudine. So इन दोनों में से कोई भी एक चीज, either emtricitabine or lamivudine plus tenofovir, that is the drug of choice for pre-exposure. When do we give pre-exposure? Pre-exposure prophylaxis उनमें देना है who are habitual offenders, who are like having unprotected intercourse, who cannot use condoms or safe sexual practices, and वो recreational drugs use कर रहे हैं, and in those cases we can start the pre-exposure prophylaxis. Okay. हाँ, कोट्राइमोक्साजोल कब शुरू करना है? ओके, कब है? ओके, काफ़ी स्टूडेंट्स इसको पूछ रहे हैं, व्हेन टू स्टार्ट कोट्राइमोक्साजोल प्रोफाइलैक्सिस. प्लीज रिमेंबर दैट फॉर pneumocystis jirovecii, we have to start when the CD4 count is less than 350 cells per millimeter cube. When the CD4 count is less than 350 cells per millimeter cube, तब आपको pneumocystis jirovecii के लिए डबल स्ट्रेंथ कोट्राइमोक्साजोल शुरू करनी है. And when are you going to stop it? We are going to stop when the CD4 count is more than 350 cells for at least 6 months. So it has to stay as more than 350 cells for more than 6 months. Then you are going to stop the prophylaxis for pneumocystis jirovecii prophylaxis. Okay, that is called TMP-SMX. Yes, TMP-SMX is cotrimoxazole. TMP-SMX, it is cotrimoxazole. That is the same name, beta. TMP-SMX, that is the same name, cotrimoxazole. रुबेला आइसबर्ग, दिस हैज बीन टॉक ऑफ द टाउन. काफी स्टूडेंट्स ये पूछ रहे हैं रुबेला आइसबर्ग का क्या करना है. रुबेला आइसबर्ग, डज इट शो और नॉट शो? प्लीज नोट, yes it does show iceberg. Why? Because rubella has 50% of asymptomatic infections. Asymptomatic infections is there in 50% cases. Very simple answer. That is the reason rubella will always show iceberg. कितने टाइम तक देना है प्री एक्सपोजर? जब तक भैया हमारा वो रिक्रिएशनल ड्रग्स यूज कर रहा है तब तक देंगे. सो टिल द टाइम पीपल आर ससेप्टेबल टू HIV, till that time you're going to give. It has to be taken as 1 tablet of tenofovir plus emtricitabine to be taken as daily. Line graph, we have already talked on this. Line graph, please note, it is a type of graph where you talk about the time trend. Time trend. Line graph is always about the time trend. PP donning, kit donning, I don't think अब ये क्वेश्चन पूछेंगे आपसे. आई डाउट ऑन दिस. PP कैसे किट पहनते हैं, उतारते हैं. दिस हैड बीन आस्क्ड अ फ्यू years बैक. वाई? बिकॉज उस टाइम पे COVID-19 चल रहा था. बट अगर अब आप देखें, आई डोंट थिंक इट विल बी आस्क्ड नाउ. So if you just look at the PP donning and doffing criteria, this is what we have beta. How to wear the PP. Wearing on को हम donning कहते हैं. PP किट पहनने के तरीके को हम donning कहते हैं. सबसे पहले क्या पहनेंगे? First we are going to wear the gown or the apron. Gown or the apron. Second पे we wear the mask. Third, we have to protect the face, that is face shield or the eyes. And last is always the gloves. Last is always the gloves. In case you are using double pair of gloves, you have to wear the gown, wear the mask, wear the shield, wear the gloves, again wear the last pair on this glove only. So in donning criteria, it is this always the same. The gown, then the face mask, then the eye cover or the face shield, and then the gloves. How to take off. जो चीज़ सबसे पहले पहनी थी वो सबसे पहले उतरेगी, सबसे लास्ट में पहनी थी वो पहले उतरेगी. That is the first to take off is gloves. Second, you have to take off your face shield. Usually the lower or the bottom string सबसे पहले खोलनी है. It is the bottom string which is taken out first. And then you take out your gown or the apron, and last to take out is always the mask. Remember, the last to take out is always the mask. उतारने की प्रक्रिया को, taking off, is what we call as doffing. Taking off is what we call as doffing. So we can have donning or the doffing criteria, and that is what was asked a few years back. Vaccines which are contraindicated in pregnancy. Beta, please note that there is no vaccine which is contraindicated except the live vaccine. All live vaccines is contraindicated in pregnancy. Otherwise, there is no other contraindication. All live vaccines are contraindicated except the yellow fever vaccine. Except the yellow fever vaccine. Why? Because it is under international health regulations. What do you mean by next MCQ? Lead time. ये क्वेश्चन स्क्रीनिंग ऑफ डिजीज चैप्टर से है. व्हाट डू यू मीन बाय लीड टाइम? बेटा, लीड टाइम, व्हाट डू यू मीन बाय लीड टाइम? सो यू ऑलरेडी नो दैट देयर इज अ रिस्क फैक्टर. The risk factor will lead to some pathogenesis, and pathogenesis will lead to the clinical features. ऐसे ही चलती है कहानी. Risk factor, pathogenesis will lead to clinical features, right? So if you diagnose at the clinical features, that is we call as the usual point of diagnosis. Now जैसे ही बॉडी में पैथोजेनेसिस हुआ, there could be some first possible point of diagnosis where it is very like early stage, very early stage. But at this junction, the investigation will be very expensive, है ना? Because it is first time happening in the body, very expensive investigation. Then there is something called as the critical point of diagnosis. There is a critical point of diagnosis. At this junction, the investigation, it is affordable and it is acceptable by the population. It is affordable and acceptable. So please remember the time difference between, that is what the MCQs are. The time difference between, please write down the time difference between the first possible point and the usual point. So that is this point. The time difference between the first possible point and the usual point. So time difference between the first possible and the usual point, this time difference, this is what we call as the screening time. What is this called? This is called as screening time. This is called as screening time. Next is the time difference between the first possible point and the critical point, beta. This is what we call as the sorry. The time difference between my mistake. The time difference between the first possible point and the usual point is not the screening time. It is called as the lead time. It is called as the lead time. This is called as the lead time. And the time difference between the first possible point and the critical point, beta, this time difference is what we call as the screening time. This is what we call as the screening time. Just a small correction over here, slip of tongue. First possible point and the usual point, that is lead time. First possible point and the critical point is called as the screening time. Okay. Okay, so first possible point and the critical point of diagnosis, this is called as screening time. This is called as screening time. The time between the risk factors onset and the first sign and symptom, this is what we call as the latent period or the latent time. This is called as the latent period or the latent time. So please remember the time difference between the first possible and the usual point, first possible and the usual point. What is that called? That is called as the lead time. And first possible and critical point, iske time ko kya kehte hain? This is what we call as the screening time. Generation time beta alag cheez hoti hai. What is generation time? Generation time is the time between entry of organism and maximum communicability. And maximum communicability, that is what we call as generation time. वो entirely अलग concept है. That is entirely different concept. Okay. Lead time is also done. How do you calculate the positive predictive value? I think just before the session was about to start, some of the students had asked this on the Telegram as well, that how do we assess for the positive predictive value? So how do you check for the positive predictive value? How do we check for the positive predictive value? Let us say that this is your table. This is your 2x2 table that you have. And let us say that this is the 2x2 table. There are people with disease and there are people who are without disease. Okay. The test could be positive or the test could be negative. Let us say that the people who are disease and the test is positive. What is this? What is this? Disease and the test is positive. This is what we call as true positive. People who are non-disease and the test is negative. What is this? This is called as true negative. People who are disease and the test is negative. People were actually disease but the test by chance negative आ गया है ना. People were actually disease. बंदा बीमार था और उसको आपने बोला, टेस्ट ने बोला कि टेस्ट नेगेटिव है. What is this? True, false positive, false negative. This is what we call as false negative. Okay. And banda healthy tha, you say that bhaiya tere ko bimari hai. This is what we call as false positive. Am I correct? This is what we call as false positive. 47,000 complete, sir. Congratulations. किस चीज का 47,000 complete हुआ है? I don't know. What 47,000? Congratulations anyways. Okay, good. बताना मेरे को यार भाई. Medico Vishal, what about 47,000? Okay, very nice. So everybody answering correctly. False positive, false negative. How do you calculate sensitivity? Sensitivity is given by the formula true positive divided by the total disease plus true positive divided by the total disease plus, that is true positive divided by true positive plus false negative. On the other hand, the specificity, it is given by true negative divided by true negative plus false positive. Can I say that this is true negative divided by D minus? On the same principle, we can also calculate the positive predictive value. Beta, positive predictive value, it is true positive divided by true positive plus false positive. On the same principle, we can calculate the negative predictive value. Negative predictive value is true negatives divided by true negatives plus the false negative. True negative divided by true negative plus false negative. ये होता है negative predictive value. Okay, so true test positive, test negative, sensitivity, specificity, ये अच्छी तरह से अपने जहन में डाल लो. इसके अलावा क्वेश्चन नहीं आएगा, ये मेरी गारंटी है. ये ही क्वेश्चन आएगा, ये बस इसको रट लो आप और ये रट के जाना. ये काफ़ी दफ़ा पूछा गया, ये नहीं मैं बोलूँगा दिस इज़ 100 स्टार, ऐसा 100 स्टार नहीं है, इट्स नॉट 100 स्टार, बट अगर ये आ गया, ये आपको टन टनाटन टन MCQ सॉल्व कर देता है. ओके, इट्स समथिंग लाइक मैथमेटिक्स. आपके पापा मम्मी बोलते थे ना बचपन में कि मैथ्स है 100% आएगा अगर पढ़ लिया तो. ये ऐसा क्वेश्चन है, ये मैथ्स है, आ गया तो ठक करके आंसर होगा, नहीं आया तो ठीक है, अब नहीं आया तो नहीं आया. So ले दे के what do I want you to understand? You remember this true positive, this true negative, this false positive, and this is false negative. बोलो मेरे साथ true positive divided by ये, what is this? This sensitivity. बोलो मेरे साथ true negative divided by the total D minus, what is this? This specificity. On the same principle, true positive divided by total positive, tested positive, what is this? This positive predictive value. On the same principle, true negative divided by the total tested negative, what is this? Negative predictive value. This is what we call as negative predictive value. ना FYI बिल्कुल दिमाग पे जहन नहीं लगाना. थैंक यू मेडिको विशाल, यूट्यूब सब्सक्राइबर 47,000 हो गए. आपका बहुत बहुत शुक्रिया. आप सब बच्चों का प्यार है कि ये यहाँ तक पहुँचे हैं. एंड थैंक यू सो मच. ऑल्दो मैंने कभी आज तक सब्सक्राइबर देखे नहीं थे, लास्ट मैंने देखे थे दे वर अराउंड 15,000. So thank you so much Medico Vishal, and it's thank you for keeping track on that. So FYI formula is very easy to remember and इसको अप्लाई करना उससे भी easy है. क्यों? क्योंकि एग्जाम में लिखा ही होता है कि भैया 90, ध्यान से सुनना मैं क्या बोला, 90 people out of 100 disease were tested positive. Out of 100 disease were tested positive. Calculate sensitivity. अब जिस स्टूडेंट ने, द स्टूडेंट हु हैज नॉट रेड एनीथिंग, वो तो अपने बाल पकड़ के नोचेगा. द स्टूडेंट हु हैज अंडरस्टूड, क्वेश्चन खुद ही तो बोल रहा है इन एग्जाम्स इट्स सुपर डुपर इजी, यू डोंट नीड अ पेन ऑल्सो. 90 आउट ऑफ 100, 100 टोटल लोग थे, 100 टोटल लोग थे. आउट ऑफ दीज 100 लोग 90 were having disease, 90 were tested positive. So calculate the sensitivity. क्या आंसर होगा? सीधा ही तो लिखा हुआ है 90 by 100, 90% हो गया. 90% ऑफ टाइम्स आपका जो MCQ आएगा बेटा, that will be like this MCQ only. 90% ऑफ टाइम्स MCQ will be very very simple. आपको दिमाग लगाने की ज़रूरत नहीं होती एग्जाम में. ओके सर, ट्रू पॉजिटिव इंटू ट्रू नेगेटिव डिवाइडेड बाय फॉल्स नेगेटिव एंड फॉल्स पॉजिटिव, ये क्या था? ये कुछ नहीं था, इसको छोड़ दो. ये ऑड्स रेशो को आप मिक्स कर रहे हो. डिग्री ऑफ एग्रीमेंट का के वैल्यू, नहीं. सार्थिका सिंह, ये यू आर कंफ्यूजिंग डिग्री ऑफ एग्रीमेंट्स, दैट इज कापा स्टैटिस्टिक्स, दैट इज सेपरेट. वो अभी छोड़ दो आप, कापा स्टैट्स वगैरह छोड़ दो. Right? So please note that it is super duper easy to remember in your exam, and it is not a difficult MCQ. Mind ये याद रखना, जब आप क्लास एग्जाम हॉल में बैठे होगे, एग्जाम दे रहे होगे ना, तब आप मेरी बात याद रखना, ये बहुत easy questions होते हैं और ये आ गया तो you will be the lucky ones who are going to solve this question, right? Okay. डिस्कैडेट फ्यूजन. सर मेरा क्वेश्चन, डिस्कैडेट फ्यूजन सॉल्व करने को आएगा? सॉल्व करने को नहीं आएगा, बस इतना ही सॉल्व करने को आएगा. हाँ, कापा स्टैट्स वगैरह INI सेट में इट मे बी रिक्वायर्ड बट नॉट एट ऑल. कापा स्टैट्स मतलब एनबी की इतनी हैसियत नहीं है कि वो नीट एग्ज़ाम या एफएमजी में कापा स्टैट्स पूछे. INI सेट में एम्स वाले वो उनकी बहुत हैसियत है, उनकी बहुत औकात है, वो सब पूछ सकते हैं. So yeah, I have to prepare you for the AIMS level exam, and that we are always doing. Before ये कापा स्टैट्स का क्वेश्चन आपके एम्स में आया था, मैरो के लेक्चर्स में कापा स्टैट्स अवेलेबल था आपके पास, पर्ल्स में था, क्यू बैंक में था, प्लस हमारे वीडियो लेक्चर्स में था. क्योंकि वीडियो में था ऑब्वियसली वो क्यू बैंक में गया, वो ऑब्वियसली पर्ल्स में भी गया. सो कापा स्टैट्स अकेला मैरो प्लेटफॉर्म हमारा ऐसा था जहाँ पे कापा स्टैट्स क्वेश्चन वॉज डिस्कस्ड. एंड इसके अलावा हाउ टू सॉल्व कैप्लन मीयर सर्वाइवल एनालिसिस, दिस वाज डिस्कस्ड इन आवर लेक्चर्स. एंड INI सेट में आई मेक इट अ पॉइंट दैट वी normally tend to discuss good higher amount of biostats just because it's a competitive exam. वो पास फेल एग्जाम नहीं है ना, उसमें तो इट्स ऑल अबाउट लाइफ एंड डेथ है ना. तो मेक श्योर दैट यू गो वेरी स्ट्रॉन्ग इन योर लाइफ. ऐसे हंसी मजाक ये ना मैं हर टाइम बच्चों को बोलता हूँ कि जो लोग आपको बोलते हैं ना कि यार आराम से बैठो एग्ज़ाम हो जाएगा, वो सब बेकार की बात है, वो आपके दुश्मन है बेटा. अगर आपने धक्का नहीं खाया, इफ़ यू हैव नॉट फेस द हार्डशिप्स, अगर आपको लगता है कि सब कुछ रोज़ी रोज़ी होगा, सब कुछ प्यारा होगा, मम्मी पापा आएंगे वो आपको सीट दिला देंगे, तो ठीक है आपको सीट मिल जाएगी, पर आप लाइफ में ना कभी कुछ कर नहीं पाओगे, ये पक्की बात है. एक दफ़ा धरती को छू लो, एक दफ़ा घुटने टिक जाए, एक दफ़ा आपके आंसू निकल जाए ना, तब मतलब आंसू इन द सेंस नॉट रियल सेंस, आंसू इन द सेंस वंस यू डू योर हार्ड वर्क, उसके बाद जब आप उस हार्डशिप्स को ओवरकम करते हो, उस टाइम पे यू आर गोइंग टू अचीव समथिंग इन लाइफ. एंड दैट इज़ द टाइम वेर यू एक्चुअली बी यूजफुल टू द कम्युनिटी. वहाँ तक आपको लेकर आना है. एंड वहाँ तक आने के लिए रास्ता जो है वो आसान नहीं होता, यू हैव टू स्ट्रगल फॉर इट. वो जितना मर्जी मैं आपको बोल लूँ बेटा सब रोज़ी रोज़ी होगा, हम ऐसा करेंगे, हम ये कर लेंगे, सब हो जाएगा, ऐसा कुछ नहीं होता. यू हैव टू वर्क फॉर योर सेल्फ. आपको खुद के लिए पढ़ना पड़ता है, और वो जब तक आप पढ़ेंगे नहीं तब तक आपका मतलब अगला पड़ाव जो है वो आप डिज़र्व नहीं करते हो. ऑफ कोर्स मिल जाता है कईयों को, बट ऑफकोर्स आई ऑल्सो वांट कि सबका क्लियर हो, सब कुछ हो, बट येस यू हैव टू वर्क फॉर इट बेटा. बस ये मेरा कहने का है कि आपको करना है उसको. ठीक है, प्लीज मेक श्योर कि आप ये करो, ये करना ज़रूरी है, राइट. सो डोंट गेट स्केर्ड. ये डरना नहीं है इन चीज़ों से, ये कभी भी नहीं डरना नहीं है इन चीज़ों है कि ये एक टीचर आया जी, एक सर आया, वो ऐसे ही हवा में बोल के गया. अरे हम लोग इसलिए बोल रहे हैं क्योंकि सब लोग इस दौर से गुजरे हुए हैं. जब तक आपने ज़मीन की मिट्टी चखी नहीं है ना, तब तक मैं कहता हूँ आपको सोने का मतलब गोल्ड का या हीरे का जो चमक है वो समझ नहीं आती है. वो हीरे की चमक समझने के लिए आपको कोयले की खान में, आपको मिट्टी की खान में घूमना पड़ता है, तब आपको हीरे की चमक समझ में आती है. प्यासे को ही पानी की अहमियत है. बंदा ऑलरेडी पानी पिया हुआ, उसको कितना पानी पिलाओगे, है ना. तो पानी तो इट्स जस्ट अबाउट द वाटर. बट वॉट मेक्स वाटर एज वेरी टेस्टी इज व्हेन यू हैव दैट थर्स्ट. वो प्यास लगाओ अपने अंदर, और उसके लिए काम करना है बेटा. चलो एनीवेज, ये बहुत हुई हमारी बाबा जी वाली बातें. लेट अस गेट बैक टू स्टडीज एंड लेट्स टेक ऑन एंड लेट्स फिनिश द टॉपिक फॉर द डे विच वी हैव डिसाइडेड. एंड चलो फटाफट से बच्चे लोग आगे चलेंगे. हमारे क्वेश्चन कहाँ गया, ये रहा. सो पॉजिटिव प्रेडिक्टिव वैल्यू कैलकुलेशन आपका हो गया. ओके, पॉजिटिव प्रेडिक्टिव वैल्यू आपका हो गया. नेक्स्ट इज काई स्क्वायर टेस्ट यूज. वी हैव ऑलरेडी डन. काई स्क्वायर टेस्ट कहाँ पे होता है, नॉन पैरामीट्रिक टेस्ट होता है. इट इज़ अ नॉन पैरामीट्रिक टेस्ट, एंड अगर सिंगल बेस्ट आंसर आ गया, इट इज़ डन फॉर 2 ग्रुप्स. अनपेयर्ड टी टेस्ट वी ऑलरेडी टॉक्ड. इट इज़ फॉर क्वांटिटेटिव डेटा जहाँ पे मेजरेबल डेटा होगा, मेजरेबल डेटा होगा. एंड इट इज़ अनपेयर्ड टी टेस्ट. इट इज़ फॉर 2 ग्रुप्स. It is unpaired t-test. It is for 2 groups. Next is control tipping land use. ये एक बहुत frequently asked question है. It is a very frequently asked question. Control tipping land use, that is waste disposal methods. Waste disposal methods. जो हमारे वेस्ट डिस्पोजल मेथड्स हैं बेटा, काफ़ी दफ़ा एग्जाम में पूछे गए हैं. एक होती है वेस्ट एरिया, सिक्योर लैंडफिल. ये जो लैंड एरिया है दैट हैज़ टू बी 10,000 पर ईयर. हमारे को लोगों के लिए 1 एकड़ लैंड चाहिए. 1 एकड़ लैंड इज रिक्वायर्ड फॉर 10,000 पॉपुलेशन पर ईयर. 1 एकड़ लैंड चाहिए होता है. दिस ये हो क्या रहा है, व्हाट इज ऑल दिस? प्लीज नोट दैट जो सॉलिड वेस्ट डिस्पोजल है, सॉलिड वेस्ट डिस्पोजल, इट कैन बी डिस्पोज्ड बाय कंट्रोल्ड टिपिंग. What do you mean by control tipping? Control tipping मतलब एक एरिया में you just throw that garbage and refuse and dump and everything. So control tipping can be done in plain areas जिसको कहते हैं area method, or we can use in hilly areas we use a ramp method. Ramp method. Okay. हिली एरियाज में आप रैम्प बना देते हो. एरिया मेथड में we need 1 acre land फॉर 10,000 पॉपुलेशन पर ईयर. इतना बड़ा एरिया चाहिए. दैट इज फॉर सॉलिड वेस्ट डिस्पोजल. अब बात आती है फीकल मैटर या लिक्विड वेस्ट डिस्पोजल को. सॉलिड मैटर या लिक्विड, सॉलिड मैटर, फीकल मैटर या लिक्विड वेस्ट, बोर होल लैट्रिन्स एंड पिट लैट्रिन्स. बोर होल एंड पिट लैट्रिन्स का साइज कई दफा पूछा जाता है. बोर होल ज्यादा लंबा होता है 20 फीट का. पिट लैट्रिन इज मोर ब्रॉड and 15 feet का. They both will be applicable for one family for 5 to 6 years. Next is septic tank का पूछा जाता है that cleaning should be done after every how many years. Usually minimum 200 liters का होता है and it could be way more than that. 200 liters को 5 yearly हमें clean करना पड़ता है. Next is कई दफ़ा पूछा जाता है temporary method क्या होता है. Temporary method for waste disposal इन कैंप एरियाज में. कैंप एरियाज में हम वेस्ट डिस्पोजल को बेटा ट्रेंच मेथड से फेंक सकते हैं. द ट्रेंच मेथड कैन बी शैलो ट्रेंच और डीप ट्रेंच. शैलो ट्रेंच जो होता है, शैलो ट्रेंच और डीप ट्रेंच. जो शैलो ट्रेंच होता है वो छोटा होता है, डीप जो है वो डीपर है. दैट्स इट. So it's a temporary method for waste disposal. It is a burial method. Burial method can be used as temporary method for waste disposal. Okay? जल्दी जल्दी करा दो, आलू के पराठे ठंडे हो रहे. क्या बात है यार, भूख तो मेरे को लगाई. मेरे घर पे भी खाना बन गया है, सो अभी मेरे को आवाज़ भी पड़ रही है. Let's just finish off and very quickly I think we are done with that. ये वेस्ट डिस्पोजल मेथड्स आपको काफ़ी दफ़ा एग्जाम में पूछे गए हैं. केस कंट्रोल स्टडीज, क्रॉस प्रोडक्ट रेशो, वी हैव ऑलरेडी डिस्कस दिस, बट इसमें एक चीज़ और इम्पॉर्टेंट है बेटा. केस कंट्रोल स्टडीज में ऑड्स रेशो निकलता है और इसमें कोहॉर्ट स्टडीज में हमारा रिस्क रेशो या रिलेटिव रिस्क निकलता है. कोहॉर्ट स्टडीज में अगर ऑड्स रेशो या रिस्क रेशो बेटा इक्वल टू 1 हो जाए, इसका क्या मतलब है? दिस मीन्स देयर इज नो एसोसिएशन. इफ द ऑड्स रेशो और द रिलेटिव रिस्क इज लेस देन 1, मतलब 1 से नीचे है, 0.9, 0.8, दैट मीन्स देयर इज अ नेगेटिव एसोसिएशन. और वट एवर फैक्टर वी वर असेसिंग, दैट फैक्टर इट इज अ प्रोटेक्टिव फैक्टर. It was a protective factor, and if it comes out to be more than 1, it means a positive association. या फिर जो भी आप फैक्टर असेस कर रहे थे, whatever factor you were assessing, that factor it is a risk factor. कि वो चीज़ जो है वो कॉज कर रही थी डिजीज, it is a risk factor. Okay, so that is what you need to remember for case control studies. Principal unit of administration. This has been asked 2-3 times in your exam. What is the principal unit of administration? Please remember that you already know there is a district hospital सबसे ऊपर, then there is a CHC, then there is a PHC, and then there is sub center. And उनके नीचे हमारे पास होती हैं आशा वर्कर्स या ऊषा वर्कर्स, अर्बन आशा वर्कर्स एंड सो ऑन, है ना. यहाँ तक तो सबको पता है. इस पूरी गेम में वेयर इज द हेल्थ प्रोग्राम एडमिनिस्ट्रेशन? मैं कहूं या ना कहूं, वट एवर द क्वेश्चन विल बी, administration is always at a district level. We have district level administration in government of India. District collector होते हैं हमारे पास, district level पे district health officers होते हैं, district program officers होते हैं. So all the program managers, all the program officers, they are available at what level? They are all available at district level. यहाँ तक क्लियर है? Which is the highest unit of integrated health services? The integrated health services is maximum highest level is PHC. क्यों मैं PHC बोला? Because PHC पे बेटा health promotion होता है, health prevention भी होता है, like disease prevention. They also offer curative services and they also offer rehabilitative services. Everything is given best at what level? Best integrated level health services. It is given at PHC. At CHC, it is primarily curative services. At district hospitals, it is tertiary level healthcare. It is rehabilitative services and specialized healthcare is available at a district level. Community health centers, they are predominantly for curative services. PHC पे सब कुछ होता है, health promotion, health prevention, health curative and rehabilitative services. Sub centers, they are primarily basically for primary level prevention. They offer preventive services more than curative services. But yes, ये दोनों करते हैं, दोनों होते हैं, प्रिवेंशन एंड क्यूरेटिव, बट मोर प्रिवेंशन एंड लेस क्यूरेटिव, बट येस इट इज कंबाइंड थिंग. एंड लास्ट इज आशा उषा. दे आर प्रेडोमिनेंटली फॉर, दे आर आवर फील्ड वर्कर्स एंड ये काफ़ी दफ़ा एग्जाम में पूछा जाता है. ओके, लॉन्गिट्यूडनल स्टडी एंड वर्टिकल स्टडी सेम और डिफरेंट? लॉन्गिट्यूडनल स्टडी बेटा, लॉन्गिट्यूडनल होता है जहाँ पे आप कहीं आ जा रहे हो बेटा. लॉन्गिट्यूडनल स्टडीज आर वेयर यू कम एंड गो. So longitudinal studies, इसमें आती है case control and cohort studies. Vertical studies, there is nothing called as vertical studies. Vertical studies are something like cohort studies, जहाँ पे आप follow up करते हो. Those are the vertical studies. सर एक बार types of PHC बता दो. वो type A और type करके है. Type A PHC होता है. Yeah, we have already discussed this बेटा. PHC can be of many types. ये ऑलरेडी हमने बात किया हुआ है. PHC A होता है, PHC B होता है. PHC A होता है जहाँ पे लेस देन 20 डिलीवरीज होती हैं बेटा. PHC टाइप B होता है वेयर देयर आर मोर देन 20 डिलीवरीज. ऐसे ही सब सेंटर टाइप A और सब सेंटर टाइप B होता है. A मतलब होता है देयर इज नो डिलीवरी फैसिलिटी, एंड सब सेंटर टाइप बी होता है वेयर देयर इज अ डिलीवरी फैसिलिटी. ओके, सो ये जितने भी हमारे पास मदर एंड चाइल्ड हेल्थ सेंटर्स हैं, यहाँ सब में वी हैव टाइप ए एंड टाइप बी, सब सेंटर टाइप ए एंड टाइप बी सेंटर्स. एडल्ट्रेशन ऑफ फूड इन लॉ का नाम पूछा गया था बेटा. इट इज FSSAI. व्हाट इज FSSAI? फूड सेफ्टी एंड स्टैंडर्ड्स अथॉरिटी ऑफ इंडिया. Next is chest in drawing. Beta, chest in drawing, again it is a 200 star MCQ. You have to do this from pediatrics. Pneumonia की guidelines, management of pneumonia, management of acute respiratory illnesses, ये सब कुछ बहुत ज़रूरी है. इसको pediatrics से पढ़ना आपको पड़ेगा. Chest in drawing and pneumonia की guidelines. Just to show you जो हमारे पास रीसेंट WHO गाइडलाइंस है बेटा, जस्ट टू शो यू जो रीसेंट WHO गाइडलाइंस हैं. आई जस्ट इंक्रीज द साइज ऑफ दिस जस्ट टू शो यू जो रीसेंट WHO गाइडलाइंस है बेटा. निमोनिया कैन बी डिवाइडेड इनटू 3 कैटेगरीज. वी कैन हैव नो निमोनिया, वी कैन हैव निमोनिया, or we can have severe pneumonia. Okay, in very young children age less than 2 months, any type of severe pneumonia, we also call it as very severe disease. It is also called as very severe possible bacterial infections. So because in very small infants, we don't understand many things, what could be the root cause, or generally speaking, the treatment is almost the same. So generally 2 महीने से 5 साल के बच्चे में नो निमोनिया, निमोनिया या सिवियर निमोनिया आपको कैटेगराइज करना होता है. नो निमोनिया इज गिवन ग्रीन कैटेगरी, the pneumonia is given the yellow category, and the severe pneumonia or very severe disease, it is given the red category. Green category mein, what are we going to do? We are going to give home care advice to the family members, to the mother and to the parents या grandparents जो भी हैं. Yellow category में, you have to give them treatment. You have to give them treatment plus the home care advice. And red category, it is urgent referral. It is referral to the nearest health center. अब बच्चा कैसे कैसे डलेगा. नो निमोनिया होता है, देयर इज कफ एंड कोल्ड. निमोनिया इज व्हेन देयर इज, प्लीज नोट ये एमसीक्यू इंपॉर्टेंट है, व्हेन देयर इज फास्ट ब्रीदिंग एंड और चेस्ट इन ड्रॉइंग. चेस्ट इन ड्रॉइंग है या नहीं है. इन केस देयर इज टैकीपनिया, इट इज pneumonias. Now, in case there is any other danger signs like not able to drink, the child is lethargic, the child is having some stridor, or child is throwing out convulsions, in those cases you common sense have to categorize it as a severe infection or severe disease or severe pneumonia, and you have to give the first antibiotics and refer to the facility for injectable proper antibiotics. Okay, so please make sure you get this question right for pneumonias and how do you categorize pneumonias. Standard deviation का formula पूछा गया था. Next is standard deviation का formula. What is the formula for standard deviation? बेटा standard deviation is given by RMSD. It is a 5-star MCQ, very frequently asked in your exam. What is RMSD? RMSD stands for the root of mean of squared deviations. Remember RMSD, root of mean of squared deviations. RMSD इसका क्या मतलब है? What is the formula? कैसे याद रखोगे? Root mean square deviation. It is square root of, okay, सबसे पहले आ गया ना square root. It is square root of mean. Mean कैसे बनाते हो बेटा? Summation divided by the sample size, है ना? So it is square root of mean of squared deviations. How do you find the squared deviations? X minus x bar square. Square करा deviation का, deviation from the mean. So square deviations. So square root of mean of squared deviations. That is what we call as RMSD, standard deviations का formula. ये बहुत दफ़ा घिसा हुआ MCQ है कि यदि आप ये नॉर्मल डिस्ट्रीब्यूशन देखते हैं, इसमें जो सेंटर पॉइंट है दैट इज ऑलवेज द मीन और द मीडियन और इट इज़ द मोड, एक ही चीज़ होता है. देन यू हैव +1 SD, देन यू हैव +2 एंड देन यू हैव +3. बैक साइड पे यू विल हैव -1 SD, -2 SD and then you have as -3 SD. Okay, so anything which lies between +1 and -1, it is 68% of the values. Between +2 and -2 standard deviations, we have as 95% of the values, and between +3 and -3 we have 99% of the values. फिर से लिखेंगे, between +-1 standard deviation, how many values? 68%. Between +-2 SDs, how many values? 95%. Between +-3 standard deviations, how much values? 99% of the values will lie. This is a घिसा हुआ MCQ, very frequently asked MCQ. Low weight of the baby कितना होगा to categorize it as severe pneumonia? It was a question on the Telegram channel. Low weight of the baby to categorize it as severe pneumonia. So I'm not sure on this. How do you categorize the low weight of the child? So severe malnutrition is same answer. It is severe malnutrition. If the child is less than -2 standard deviation, it is mild to moderate malnutrition. If the child is less than -3 standard deviation, it is severe malnutrition. So less than 3 would be the correct answer in this case. Anyways, coming back to this story, standard deviation, it is given by the formula root mean square deviation +-1 SD, 68, 95 and 99. right? So SANS guidelines, nothing much. SANS guidelines only if they say SANS, only in those cases you have to answer SANS. Otherwise, you will answer only WHO guidelines. In India, we follow WHO guidelines. हाँ, SANS is followed at a field level. Field level में SANS guidelines use करते हैं. SANS you will answer only if the SANS word is written. Otherwise, please answer WHO guidelines only. Only WHO guidelines are required. Okay, chalo, let's go ahead and talk about the next one. Vitamin A dose in keratomalacia. Beta, what is the dose of vitamin A? Vitamin A भी काफ़ी दफ़ा पूछा जाता है. Vitamin A, it is an important cause of nutritional blindness in India. So vitamin A का जो डोज रहेगा, अगर बच्चा जो है less than 6 months of age है, in those cases it is 50,000 international units. In case the child is 6 months to 1 year, then the dose is 1 lakh international units, and if the child is more than 1 year, the dose is 2 lakh international units. So vitamin A prophylaxis के लिए, prophylaxis, please note, vitamin A prophylaxis के लिए we give from 6 months to 1 year. We give 1 lakh international units, and then after 1 year we give 2 lakh international units 6 monthly. It is given 2 lakh international units 6 monthly. So ये प्लीज़ नोट कि बेटा ये जो चीज़ है ये प्रोफाइलैक्सिस के लिए है. अगर यही आपको ट्रीटमेंट के लिए पूछा जाए इन केस ऑफ definite vitamin A deficiency, ध्यान से सुनना, very very carefully listen to it. In case they ask you about the definite vitamin A deficiency for treatment के लिए we give vitamin A doses on day 0. Then you give it the next day, same dose you repeat it next day only, and then you repeat it after 14 days, day 0, day 1 and day 14. But इनको हम mega doses कहते हैं, that you give the double dose within 2 days for vitamin A. But ये सिर्फ treatment के case में जाएगा, and generally speaking for prophylaxis we do not give vitamin A prophylaxis to age less than 6 months. राइट. सैम में कितना विटामिन, ये एज एंड वेट देख के वी गिव द विटामिन ए, एंड ये ट्रीटमेंट में वी गिव द विटामिन ए इन केस द चाइल्ड इज हैविंग विटामिन ए नोन डेफिशिएंसी 0, 1 and 14. Breast cancer screening tool prevention, beta. What is the level of prevention for breast cancer? If it's a very standardized MCQ, breast cancer के लिए what is the investigation of choice? The screening test of choice. The screening test of choice, it is not a self palpatory method, self breast examination. It is mammography. Mammography is the screening test. And breast cancer की जो screening है, what is the level of prevention? Level of prevention क्या रहेगा? If you use mammography, what do you want to answer? करो answer. Yes, यश ने बिल्कुल, यश, very nice. I'm so happy for you. It is secondary. Thankfully, you have not said primary prevention. It is secondary prevention. Why? Because it is early diagnosis of the disease. It is early diagnosis of the disease. It is not primary prevention. It is secondary prevention. Absolutely correct. So breast cancer, what is confounding factor, beta? Next is, what is confounding factor? What do you say as confounding factor? Confounding factor is any factor. It is a third variable. It is a third variable which is associated with the risk factor. It is associated with the disease, and it indirectly or directly may lead to the disease. So this factor is called as confounding factor. Question ये आ सकता है, how do you treat confounders? How do you treat confounders? You can have two types of confounders, beta. Known confounders, or we can have unknown confounders. The known confounders, how do you treat it? बोलो मेरे साथ, याद करो. How do you treat known confounders? We treat it by matching. How do you treat unknown confounders? RSSR, randomization, standardization, stratification, and regression. Randomization, standardization, stratification, and regression. Which is the easiest method? The easiest and the best method we always say is stratification, which is the, you can say, one of the most commonly used method or the best method. We call it as randomization is the most commonly or the best method. That is we use for unknown confounders. Very nice. Everybody knew about these confounders. 40 years से कम में शायद नहीं करते हैं सर. Yes, we do not do age less than. After 40 years we advise for females to get a mammography done depending on their genetic predisposition, age more than 35 or age more than 40. Okay, you have these different DIPSI guidelines, you have the different FOXI guidelines, and you have the different American Obstetrician Gynecologist Society guidelines. So different guidelines would be saying the answer differently. But please note, what is confounding? Confounding factor is any third variable which is associated with both the disease and the risk factor. Next is, what is the treatment of malaria under the vector-borne disease program? Beta, please remember that the treatment of malaria we can have is a Plasmodium vivax malaria. For vivax malaria we give as chloroquine. कितने दिन के लिए? फटाफट से लिखो चैट बॉक्स में. क्लोरोक्वीन कितने दिन के लिए देते हैं बेटा? क्लोरोक्वीन इज गिवन फॉर 3 days. What is the dose of chloroquine? It is given at the days or a dose of 25 milligram over 3 days. Over 3 days. 25 milligram कैसे कैसे देंगे? Day 1 पे, Day 2 and Day 3. 10 milligram and 5 milligram on Day 3. Plus we also give primaquine. It is given at the dose of 0.75 milligram per kg body weight. It is given for 14 days. So remember, for Plasmodium vivax, you can remember CQ3 plus PQ14. You can remember CQ3 plus PQ14. And in case आपसे कोई पूछता है अगर Plasmodium falciparum की treatment, तो Plasmodium falciparum में what do we give? We give ACT. What is ACT? ACT stands for, what is the full form of ACT? फटाफट से लिखो. I'm waiting for your answers. फटाफट से लिखो. ACT का full form RT mezzanine based combination therapy. It is artemisinin based combination therapy. Please note, it is not artesunate combination therapy. It is artemisinin based combination therapy. It is artemisinin based combination therapy. So Plasmodium falciparum we give ACT. ACT can be given to northeastern states. We give ACT-AL, and in all other states, we are going to give ACT, S and P. Very nice, Rithikesh Reddy. Absolutely correct. It is artemisinin based combination therapy. It is not artesunate combination therapy. So ACT is given as northeastern states ACT-AL, and other states it is ACT-SP. Plus we also give ACT alongside, we also give primaquine as single dose. Primaquine as single dose on day 2. It is given as primaquine or single dose on day 2. It is given as primaquine as single dose on day 2. Okay. So you can remember for Plasmodium falciparum as ACT for 3 days plus primaquine as single dose, 1 dose for falciparum. Next is, sometimes they ask about the treatment of malaria in pregnancy. Pregnancy में बेटा we can have first trimester. In first trimester, what is the drug of choice? It is quinine salt. It is not IV. It is quinine salts we give. Quinine salts. And in the second or the third trimester, we will give ACT, AL or SP, depending who patient is coming from which area. We can give ACT, AL or ACT, SP. Please note, primaquine is contraindicated. Primaquine, it is not given. Primaquine is contraindicated for Plasmodium falciparum malaria in pregnancy. In case this was regarding the Plasmodium falciparum, in case it is a Plasmodium vivax in pregnancy, then the answer is chloroquine given for 3 days. Please note, primaquine is contraindicated. Chloroquine alone is given for 3 days, and primaquine is contraindicated in this case as well. Okay. Last in line, last point of the day, last topic of the day, diphtheria contact management. How do you manage diphtheria cases? Whenever we get a case of diphtheria, how to manage the contacts of diphtheria? Contacts of diphtheria. Okay. किसी का कोई क्वेश्चन है? I didn't see the questions since long. Artemether, primaquine, quinine, second ACT. Sir, about HIV confirmatory test. Okay, Shubham, I will just talk to you about HIV. QLEX का flying range. QLEX का flying range. I'm just discussing all the doubts जो अभी काफ़ी देर से आए हुए हैं. सर लेफ्ट एंड राइट स्क्यू टॉपिक एक बार डिस्कस कर दीजिए बेटा. स्क्यू टॉपिक, स्क्यू कैन बी राइट स्क्यू और इट कैन बी लेफ्ट स्क्यू. राइट स्क्यू में मीन है, मीडियन है, मोड है. लेफ्ट स्क्यू में मीन है, मीडियन है, मोड है. इन केस, पहला सवाल, इन केस दे आस्क यू विच वन इज हाईएस्ट इन अ राइट स्क्यू, एवरीबडी लुक टूवर्ड द राइट. सब लोग राइट को देखेंगे. इन द लेफ्ट स्क्यू एवरीबडी लुक टूवर्ड्स द लेफ्ट. सब लोग लेफ्ट को देखेंगे. वेरी सिंपल. सो विच इज हाईएस्ट इन अ राइट स्क्यू? द हाईएस्ट इन अ राइट स्क्यू इज मीन. विच इज हाईएस्ट इन अ लेफ्ट स्क्यू? द हाईएस्ट इन अ लेफ्ट स्क्यू इज मोड. पहला सवाल. दूसरा आइडेंटिफाई. दूसरा आइडेंटिफाई आएगा. दे विल आस्क यू टू आइडेंटिफाई व्हाट इज द स्क्यू. आपको पूंछ देखनी है, सी द टेल. जिस साइड की टेल होगी उस साइड का स्क्यू होता है. दिस इज अ राइट स्क्यू. एंड अगर ये ऐसा आ गया, this is a left skew. Very simple. These are the only 2 MCQs. अगला डाउट बताओ. डिस्कैडेट फ्यूजन का डाउट है. नेक्स्ट डाउट है डिस्कैडेट फ्यूजन का. लास्ट पॉइंट है, सो इसलिए आई एम गैदरिंग ऑल योर डाउट्स राइट नाउ. जो डाउट है बेटा फटाफट से डालो. आई विल आंसर ऑल योर डाउट्स. क्यूलेक्स का फ्लाइट रेंज. क्यूलेक्स मॉस्किटो का जो फ्लाइट रेंज होता है बेटा, इट इज़ रफली 10 to 13 किलोमीटर्स. जो एनोफ्लीज है उसका फ्लाइट रेंज इज रफली 2 to 3 किलोमीटर्स. जो एडीज है उसका फ्लाइट रेंज इज रफली अराउंड 100 to 200 मीटर्स. ये घर के अंदर रहता है. इंडोर मॉस्किटो होता है, इंडोर. दिस इज यूजुअली इंडोर्स. एडीज इज यूजुअली इंडोर्स. और कोई डाउट है? प्राइमाक्विन, आर्टिमिजनिन, एसीटी, area specific infant. Yes, Rishu Grover, it is absent in primaquine is contraindicated in infants and G6PD. Sir, what about HIV confirmatory test? HIV का जो confirmatory test है, HIV का जो screening test है, screening test बेटा, we can use screening test as ELISA. It is most confirmatory. It is the investigation. It is not, sorry. ELISA is most important. It is the investigation of choice, which is the screening test. इसके अलावा वी कैन ऑल्सो यूज केमिल्यूमिनेसेंस टेस्ट. वी कैन ऑल्सो यूज क्रोमैटोग्राफी टेस्ट. दीज आर ऑल रैपिड टेस्ट. सो अगर इनमें से सिंगल बेस्ट आ जाए, द स्क्रीनिंग टेस्ट ऑफ चॉइस इज एलाइजा. व्हाट इज द डायग्नोस्टिक टेस्ट? बेटा द डायग्नोस्टिक टेस्ट इज ऑलवेज HIV PCR testing, that is the polymerase chain reaction. We can use Western blot, but Western blot आजकल obsolete हो गया. It is old test now. But what is the new update? The new update is we always have to use HIV PCR testing. So polymerase chain reaction testing, viral load estimation, it is the diagnostic test. Western blot, अगर इन दोनों में से if you have to choose out of HIV PCR testing and out of Western blot, please mark PCR testing. That is the diagnostic test. Otherwise, if it is not there, you are very free and you are very welcome to mark the Western blot. That is the HIV diagnostic test. Okay, skew भी हो गया. How to differentiate mosquito picture? बेटा अभिनंदन, mosquito picture तो I cannot draw ना यहाँ पे. So ये तो गलत आपने मेरे साथ कर दिया. Anopheles बेटा, उसका Anopheles का ना फटाफट से लिख लो। अब अभिनंदन ने क्वेश्चन पूछ लिया है, एनोफिलीज, एनोफिलीज का जो एनस है ना वो अप होता है, एनस अप, एनस अप, एनोफिलीज इट इज इंक्लाइंड पोजीशन। ओके, एनोफिलीज इंक्लाइंड होता है। एडीज जो है बेटा, एडीज रिमेंबर इट इज अ हाउस होल्ड मॉस्किटो, घर का पानी पिएगा, हाउस का पानी पिएगा, हाउस में सिगरेट पिएगा, सिगार शेप्ड इसके एग्स होते हैं। एंड एडीज मॉस्किटो इट इज पैरेलल टू ग्राउंड, एडीज इज पैरेलल टू ग्राउंड। क्यूलेक्स जो होता है इट इज हेड डाउन एंड टेल डाउन, हेड एंड टेल डाउन, इट इज कॉल्ड एज हंच बैक पोजिशन, इट इज कॉल्ड एज हंच बैक, ऐसा बैठा होता है। ओके, so that's just the way to mosquito picture. Discarded PMMS योजना का कलर कोडिंग बता दो। PMMS योजना की कलर कोडिंग बेटा रेड होता है, येलो होता है, ब्लू होता है एंड एक ग्रीन होता है। रेड कलर इट इज़ फॉर हाई रिस्क प्रेगनेंसी, येलो कलर इट इज़ फॉर कोमॉर्बिड कंडीशंस, blue category it is for PIH. What is PIH? Pregnancy induced hypertension. And green is for normal females. So blue category, yellow category, and that is under the Prime Minister Surakshit Matritva Abhiyan. It is Prime Minister Surakshit Matritva Abhiyan. सर ACT एंड AST एंड ACT डिफरेंस? AST कुछ नहीं, वी यूज ओनली ACT इन इंडिया, वी डोंट यूज AST। सर प्लीज रिपीट क्वेश्चन नंबर 37। रेपिटेशंस अभी बाद में, आप इसको रिफाइंड करके देख लो ना, ये क्या बात हुई मोहम्मद सैफ। हाउ टू डिफ्रेंशिएट मॉस्किटो पिक्चर हो तो गई, 12 महीने हैं। देन LAC राइट, ग्रुप डिस्कशन के बारे में। एलिजा इतना सुन लिया, बहुत कंफ्यूज करता है, ऑप्शन में देखते ही आंसर करने का मन हो जाता है। दैट्स ओके। HIV ट्रीटमेंट बेटा इट इज TLD। RS शर्मा, HIV ट्रीटमेंट इट इज TLD, टेनोफोवीर, लामिवुडीन, डोलोटेग्रेविर, 1 टैबलेट एवरी डे। सर डायबिटीज स्क्रीनिंग वी डू फ्रॉम फर्स्ट हैंड? अरे भैया यश मैं थक गया ये आंसर करते हैं। डायबिटीज के लिए GDM स्क्रीनिंग जो है, स्क्रीनिंग इज डन फ्रॉम फर्स्ट एंटीनेटल visit. It is done in the first antenatal visit because you want to find out early. I understand it is like we say that there is it is like overt diabetes, or we can have gestational diabetes, but we want to, at the end of the day, we want to have a normal glycemic control in a female, in a pregnant female, and to do that we do that GDM testing early in the first ANC. So dose of folic acid for prophylaxis it is double dose बेटा, 400 folic acid, 400। सर आज PSM पढ़ रहे, यूट्यूब खोला तो आप आ गए सामने, वेरी नाइस। चलो पॉपुलेशन नॉर्म्स विद नंबर ऑफ बेड्स, ये पॉपुलेशन नॉर्म्स विद नंबर ऑफ बेड्स वी हैव ऑलरेडी डन बेटा। पॉपुलेशन नॉर्म्स विद नंबर ऑफ बेड्स हमने करा नहीं था क्या? फटाफट से कर लो। नंबर ऑफ बेड्स एंड पॉपुलेशन नॉर्म्स बेटा, वी कैन हैव अ कम्युनिटी हेल्थ सेंटर, PHC, CHC, सब सेंटर्स एंड कम्युनिटी लेवल, दैट इज द आशा वर्कर्स एंड द ऊषा वर्कर्स। CHC में वी हैव क्लिनिकल स्पेशलिटीज, PHC मेडिकल ऑफिसर, ANMs, प्लस वी ऑल्सो हैव हेल्थ असिस्टेंट्स, वी हैव हेल्थ असिस्टेंट। सब सेंटर्स पे मल्टीपर्पज वर्कर। Sub center is for 3 to 5,000 population. PHC is for 20 to 30,000 population. CHC is for 80 to 1,20,000 population. Okay. In the urban sector, this is for the urban sector. In the urban sector, it is for 2.5 to 5 lakh population. Urban CHCs. Urban PHCs, it is for 50,000 population. ANM or the MCH centers beta, these are the ANM centers, these are for 10,000 population. Urban ASHA workers, it is for 1,000 to 2,500 population, 1,000 to 2,500 population. On the other hand, the ASHA worker, it is for 1,000 population, 1,000 population. Next is कई दफ़ा एग्जाम में पूछेंगे how many beds these things have. CHC beta, CHC can be FRU CHC or non-FRU we उल्टा लिख लेते हैं. Let us call this as non FRU CHC or FRU CHC. We can also have urban CHCs. These could be non FRU, or we can have FRU urban CHCs. FRU urban CHC or urban CHC. Am I correct? जो है बेटा नॉन FRU CHC, that is in rural areas, or we can have it in urban areas. The one which is non FRU stands for the first referral unit. It is roughly around 30 beds. Okay, FRU वाले में 30 to 50 beds होंगे. Similarly, for non-FRU urban CHC, it is 50 beds, and for FRU urban CHC, it is 50 to 100 beds. So if you just want to remember one answer, you can remember CHC. Can we say it is from 30 to 100 beds, depending on whether it is rural or urban, FRU or non-FRU. यहाँ तक बात clear है? So CHC में how many beds are there? 30 to 100 beds. CHC, how many beds are there? 30 to 100 beds will be there. Then is PHC. In PHC, how many beds will be there, beta? Roughly it is said 4 to 10 beds. 10 beds in urban PHCs, 10 beds minimum they need in urban PHCs which are functioning with PHC type B. You remember type B, which are high load PHCs, and 4 in rural areas, minimum they need 4 beds. Then is sub-centers. Sub-center can have 0 to 1 bed to maybe 3 beds or more. So 0 to 3 beds for sub-centers. District hospital, beta, it will always be more than 100 bedded district hospital. Usually 200 to 500 beds are there in every district hospital. So polyclinic is also for 2.5 to 3 lakh population. Yes, very nice. Polyclinic is also for 2.5 to 5 lakh population. Vitamin A dose for 1 year बता दिया. We have already discussed. नेहा मैम ने विटामिन में कुछ अलग पढ़ाया 12 months से 2 lakh international units. I don't know about this. गवर्नमेंट में तो बेटा हम यही यूज़ कर रहे हैं. आपको MCQ में whatever I am teaching that you have to mark. So with due respect to everyone, 12 months पे once the 12 months are completed, we have to shift over to 2 lakh intra. And that's what I had written up till 1 year या more than 1 year. मैंने भी तो यही लिखा था ना. Okay, so sir also तो यही होता है बेटा. So don't worry about so many different things. अगर वहाँ से पढ़ रहे हो, you should study from there. अगर यहाँ से पढ़ रहे हो, study from here. कोई गलत नहीं पढ़ाता यार, ये पक्की बात है. बस जहाँ से समझ आए वहाँ से पढ़ लो, है ना. जहाँ पे अच्छा लगे वहाँ पे पढ़ लो. Sir, ideal weight gain in pregnancy. Ideal weight gain in pregnancy, it is 10 to 12 kilograms of the total during the pregnancy. It is 10 to 12 kilograms, not less than 10, and usually we say that more than 12 is more. So vitamin A ho gaya. Measles vaccine given at 7 months. Should the next dose be given at 9 months or 16? 9 months pe beta. 7 months pe if you are giving extra measles dose, it is always extra dose. Chalo, anyways, that's all about what we had to discuss. Last point kar raha hu main discuss abhi, and then we switch off the topic for the day. Otherwise तो ये खिंचता चला जाएगा. Diphtheria contact management. How do you manage the diphtheria cases? And thank you so much for all your doubts. बाकी doubts हम कल को या next जब भी हम मिलेंगे तब लेंगे. So beta, whenever we get a case of diphtheria, for the case of diphtheria, what are you going to do? For the case of diphtheria, you have to give them DAT. What is DAT? DAT stands for diphtheria antitoxin. Diphtheria antitoxin can be given depending on different types of diphtheria, faucial diphtheria, laryngeal diphtheria. काफ़ी types of diphtheria होते हैं, severity of diphtheria होता है, उसके base पे आप diphtheria antitoxin देते हैं. Diphtheria antitoxin can be given in the dose of 20,000 to 1 lakh international units. Okay. इसके अलावा we also need to give oral erythromycin or penicillin G as the antibiotic of choice. It has to be given for 12 to 14 days. Plus हमने serial culture करना है, diphtheria toxoid और continue immunization in the convalescent phase. जो serial cultures करेंगे बेटा, diphtheria case has to be isolated till 2 negative culture reports are available, which is more than 24 hours apart. सो 2 नेगेटिव कल्चर रिपोर्ट्स, थ्रोट स्वैब कल्चर रिपोर्ट्स 2 नेगेटिव होनी चाहिए 24 घंटे दूर, मतलब 2 अलग दिन पे, तब तक आपको डिप्थीरिया केस को आइसोलेट करना है. What is the next MCQ? What is the drug of choice for carrier stage in diphtheria? Carrier stage in diphtheria, the drug of choice is oral erythromycin to be given for 10 days. So stop antibiotics after 2 negative blood cultures, and that is what is for diphtheria. Next is what to do in cases of contacts of diphtheria. In case of contacts of diphtheria, beta, in case of contacts of diphtheria, कॉन्टैक्ट ऑफ डिप्थीरिया के लिए आपको उसको एंटीबायोटिक तो देना ही है. एंटीबायोटिक तो कॉमन सेंस हमने पढ़ा था अभी, एंटीबायोटिक तो देना ही है. नाउ कॉन्टैक्ट ऑफ डिप्थीरिया को बेटा हमने एंटीबायोटिक तो दिया फॉर 7 to 10 days. इट इज 7 to 10 days. पहला सवाल. दूसरा, इस केस में कॉन्टैक्ट बच्चा है, उसके ब्रदर और सिस्टर इज हैविंग डिप्थीरिया, सो कॉन्टैक्ट नीड्स टू बी गिवन, दिस वेरी इंपॉर्टेंट, दे नीड टू बी गिवन द डिप्थीरिया वैक्सीन. In case the bacha says, the contact says, I have taken within last 5 years, I have taken the last dose and all my diphtheria vaccination is complete. So that means the younger brother of the diphtheria case, let us say that that person was maybe 7 years old or 6 years old or 10 years old, and they had taken last just 5 years, within 5 years they have taken the last immunization for diphtheria. DPT, I hope you all remember now, we give at 6, 10, 14 in pentavalent, then DPT booster 1 and DPT booster 2. So 2 boosters for DPT are given. In case they say that I have taken within last 5 years, then nothing extra needs to be done. In case they say more than 5 years, I have taken complete, but more than 5 years, you give 1 dose extra. In case the patient says, I don't know about my doses, or they had taken less than 3 doses, then you have to complete the schedule, whatever is pending. So this is ultra important. You have to check for the diphtheria toxoid. So that is your question number 2. Question number 3 is you have to send the samples for diphtheria culture, and that's what we do. That's what we do for diphtheria. हर जगह ज्ञान बट रहा है, जहां से मिले वहां से ले लो. बिल्कुल सही बोला आपने. वेरी नाइस, एब्सोल्युटली. सर व्हेन एफएमजी, अब ये और एफएमजी फुल रिवीजन, आकाश भैया आप मेरे ख्याल लेट आए हो. आई ऑलरेडी टोल्ड एफएमजी का फुल रिवीजन हैज़ ऑलरेडी बीन डन ऑन द मैरो यूट्यूब चैनल. बेटा हमने मैरो यूट्यूब चैनल पे, मैं फिर से बता दूं, मैरो यूट्यूब चैनल पे हमने ऑलरेडी कर लिया है. इट इज़ डन इन 2 parts, पार्ट 1 एंड पार्ट 2, 2 अलग अलग पार्ट्स में करा है. ये टॉपिक को सर्च कर लो और इसका मैं लिंक टेलीग्राम ग्रुप में अपने में डल जाएगा. सो इन द टेलीग्राम ग्रुप लिंक आई एम गोइंग टू शेयर दिस. यू कैन सी दिस. ये जो लिंक मेरे ऊपर है ना, यहाँ पे कहीं पे, इस लिंक को फॉलो करो और यहाँ पे आपको मिल जाएगा. ये मैं आपको भेज दूंगा. सो फुल रिवीजन हैज़ ऑलरेडी बीन डन. आज हम कर क्या रहे हैं, आप शायद लेट आए हैं. हम कर क्या रहे हैं, हम बेटा पुराने 6 साल के सारे टॉपिक वाइज डिस्कशन कर रहा हूँ मैं एफएमजी में जो क्वेश्चंस आए थे. तो अभी हमने 2019 के सारे टॉपिक्स डिस्कस कर लिए हैं. whatever have come in your exam in the last few 2-3 years. हमने 2018 वाला डिस्कस किया अभी. या सो वी हैव कवर्ड ऑल दीज थिंग्स 2018 एंड 2019. एंड अब आज बहुत हो गया. या टुडे इनफ फॉर टुडे. आपको इंस्टा किया हूँ रिप्लाई. भैया इंस्टा पे रिप्लाई मेरे को अच्छा नहीं लगता, बिकॉज इट इज़ डिफ़िकल्ट टू टाइप. प्लीज़ send it on telegram पे. don't send me personal messages. I am not able to check personal messages. You are very welcome to send it on the group. हमारा टेलीग्राम पे ग्रुप है, वहाँ पे क्विज होता है. यू अटेंड द क्विज. एवरी टाइम स्टूडेंट्स आर गिविंग द क्विज, आई एम ट्राइंग टू गिव यू द ऑडियो आंसर्स, एंड इट इज़ बाय दिस वे यू विल बी रिलेटेड टू द होल स्टोरी. ओके, नेक्स्ट हम 1-2 दिन में दोबारा मिलेंगे. आई जस्ट डिस्कस one एग्जाम एवरी डे, and this will be a series of all your FMG topics that we are going to discuss. Okay, and इसके साथ आज के लिए बहुत शुभ रात्रि है. Thank you so much for joining in today, and I wish you all the very best of luck, and make sure कि खूब अच्छी तरह पढ़ाई करते रहो. 1-2 दिन में हम दोबारा मिलेंगे for the next upcoming sessions. 2020 and 2021 के डिस्कस करेंगे. Okay, so if in case you have liked it, thank you so much for joining in. एंड मेक श्योर कि पढ़ाई करते रहो यार, ये बहुत ज़रूरी है। ये बिल्कुल नहीं सोचना कि हम आराम से चलेंगे, आराम से चल के ज़िंदगी आराम से तो सिर्फ मगरमच्छ रहता है, वो सिर्फ वैसे ही बैठना पड़ेगा, फिर कोई आएगा आपको खाना डाल देगा। अगर खुद आपको शिकार करना है तो खुद शिकारी बनना पड़ता है, और जब तक काम ख़त्म नहीं होता हम नहीं रुकेंगे। ये ज़िद है हमारी, ओके ये जिद लेके चलो, जब तक काम नहीं खत्म होता हम नहीं रुकने वाले। एंड यू हैव टू स्ट्रगल। याद रखो, जिंदगी आसान नहीं होती। अगर आपको राजा बनना है तो नौकर जितना काम करना होगा, वो तैयारी कर लो अपनी। एंड अगर आपको अच्छा डॉक्टर बनना है, अगर आपको लोगों की सेवा करनी है, इफ़ यू वांट टू बिकम गुड डॉक्टर्स, यू विल हैव टू वर्क लाइक हेल, यू विल हैव टू स्ट्रगल योर वे आउट, बिकॉज वो नहीं मिलता अपना। जब तक वो चक्की में नहीं पिसेंगे ना, ये हमेशा मैंने क्लास में बोला, जब तक वो चक्की में पिसना पड़ेगा, जब तक आप वो पिसिंग 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 नहीं करोगे तब तक आप चमकोगे नहीं। ओके, सो या नोट्स यू विल गेट बेटा, नोट्स आपको ये मिल जाएंगे। फिर वही बात, नोट्स ये इनफ है क्या बेटा? ये इनफ नहीं होता, इनफ तो कुछ भी नहीं होता। जहाँ जहाँ ज्ञान मिल रहा है सब उठा लो। व्हाट आर द लाइव एंड किल्ड वैक्सीन्स? वीडियो को रिवाइंड करेंगे, आपको मिल जाएगा लाइव वैक्सीन्स। सर प्लीज़ रिपीट लाइव। लाइव कर तो दिया। कूल बॉयज लव क्राइम टाइप्स हो तो गया, कूल बॉय लव क्राइम टाइप। चलो, थैंक यू सो मच एंड हैव अ गुड नाइट एंड कीप ऑन स्टडिंग। ओके, सी यू सम टाइम सून। चलो, थैंक यू सो मच, थैंक यू सो मच। जाओ जाओ जाओ, फटाफट सो जाओ जाके। ओके, एंड कोई डाउट्स होंगे तो प्लीज़ आस्क मी ऑन द टेलीग्राम ग्रुप एंड इंस्टा पे। आप लोग मुझे फॉलो करोगे, मैं नहीं आपको जवाब दे पाऊंगा इंस्टा पे। कुछ आपको क्वेश्चन पूछना है, यू आर वेरी वेलकम टू आस्क मी ऑन द फेसबुक, यू आर वेरी वेलकम टू आस्क मी ऑन द टेलीग्राम। ओके, चक्की पीसिंग एंड पीसिंग, यस, धर्मेंद्र बनना पड़ेगा तभी शोले निकलते हैं। चलो, ऑल द वेरी बेस्ट, बाय बाय।